format before you say go live?
We are beginning. We are already on live.
No.
Good morning, everyone. I am Kamal Narayan, CEO of ISW Council, India's premier institution for health advocacy, awareness, and behavior change. And I welcome you all to the second edition of Ayushman Bharat Conclave, a unique gathering of who's who of public health. Ayushman Bhava, this ancient adage, used to evoke blessings of long and healthy life, aptly highlighted how our ancestors clearly knew what matters most for fulfilling and productive existence on this planet. And being Shatayu or a life spanning 100 years seemed to have been a common phenomenon in that era. However, our modern society apparently lost that sense of priority for health as at the turn of 20th century, India's average life expectancy was as low as 22 years, which only slightly improved to 34 years at the time it became a modern sovereign republic. Over 7 decades later, though we have doubled our average life expectancy, for majority of Indians, living a long, healthy, and productive life is still a distant dream, as the cost of getting that life can take away the very meaning of it. The price that they have to pay for restoring health or just part of it pushes nearly 5.5 crore people, which is more than the population of South Korea, Spain, or Kenya, into poverty within a year. And amid this scenario, September 2018 witnessed a most decisive step towards making good health and care available to those who could not afford it till then or would have gone bankrupt in an attempt to get it. This beginning, known as Ayushman Bharat, heralded by the Prime Minister Narendra Modi in form of Pradhan Mantri Jan Arogya Yojana PMJ, the ambitious and world's largest public funded health insurance scheme, coupled with the mission of transforming our primary health setups into holistic health and wellness centers, has completed over 2 years with an outcome that certainly boasts of an impressive start and promises far reaching consequences in making Indians again live long and healthy life. Not only that, this has also played a critical role in mitigating the impact of the ongoing pandemic on the vulnerable families, putting many doubts and cynicism around it to the rest. Today, when over 60 lakh Indians die of non communicable diseases like heart failure, cancer, stroke, diabetes every year, and over 90 lakh of us have been infected by coronavirus, Ayushman Bharat scheme has ensured that the poorest of us were not left in the cold. Nearly 1.5 crores of beneficiaries received cashless treatment in private hospitals for many such diseases, including COVID 19, for which many could have not reached or afforded any medical support in the past. While all this have revived the dream of ensuring equitable healthcare for everyone, everywhere, turning this into a reality will be an arduous trek to reach this distant goal. And as India is gearing up for digitization of its healthcare system under its another ambitious program, the National Digital Health Mission, which will further strengthen Ayushman Bharat as cornerstone of providing quality and affordable health services to crores of Indians, we at ISW Council are back with our critical forum, the Ayushman Bharat Conclave, in its second e-avatar. The conclave today will be focusing on understanding the building blocks for the road ahead and the need to holistically address all that threatens our health, including the ever-growing burden of non-communicable diseases, as well as the newly revived threats of infectious outbreaks. And as it is happening on the eve of International Day of Universal Health Coverage, that is observed on December 12, we will again rededicate ourselves towards reaching the ultimate objective of ensuring universal quality health coverage for everyone, everywhere. So before we go ahead and introduce our very special and esteemed guests for this inaugural session of Ayushman Bharat Conclave 2.0, let's have a look on the first edition of Conclave that was held to underline the importance of this beginning and the possibilities it brought.
India, the fastest growing nation on the earth, faces the fastest growing health challenges with over 1.3 billion lives at stake. In the wake of a swelling disease burden and severely compromised health ecosystem, it was imperative that everyone gets talking about good health. Aiming to create continuous advocacy for health, the right to good air, good food, good water and good healthcare, as well as many other aspects of holistic health. Policymakers, various industry captains, community leaders, innovators, health experts, celebrities and influencers deliberate upon the many challenges and opportunities of improving health outcomes in India. The Integrated Health and Well-being Council initiatives have become the platform of choice to launch various impactful programs that drive the country towards better health. Heeding to the growing sentiments of making healthcare more accessible, the Government of India, under the leadership of Prime Minister Narendra Modi, launched the Pradhan Mantri Jan Arogya Yojana, popularly known as the Ayushman Bharat, in September 2018. With the launch of the Mega Health Scheme, health has become central to major public discourses. With the vision to amplify these efforts, we bring to you Ayushman Bharat Conclave, a multilateral forum that would engage various stakeholders, build larger consensus and drive sustained advocacy to achieve universal health cover for all Indians.
Thank you so much. So now, without further delay, let me introduce our a very esteemed panelist for this inaugural session. We will be soon joined by Honorable Union Minister of State for Health and Family Welfare, Sri Ashwini Kumar Chaube, and hopefully also by MOS for Social Justice, Sri Ramdas Athavale. But before that, let me introduce Dr. Ambrish Mittal, who is the member of Governing Board of NHA. NHA, the National Health Authority, is the agency which is implementing this ambitious PMJ scheme in our country. He is also the chairman and head of endocrinology and diabetes at Max Healthcare. Among the finest healthcare practitioners of India, Dr. Mittal was honored by the Government of India in 2015 with Padma Bhushan, the third highest Indian civilian award, and for his outstanding contribution to the field of medicine. And more recently, Dr. Mittal has been nominated the Governing Council of NHA, and he's also the president for AIIMS Gorakhpur. We are also privileged to have Dr. Professor Y.K. Gupta with us. He's the president of All India Institute of Medical Sciences, AIIMS Bhopal. Dr. Y.K. Gupta is the president for AIIMS Jammu as well. He is the principal advisor for Department of Biotechnology, Government of India, and the former dean of academics and head of Department of Pharmacology at All India Institute of Medical Sciences, New Delhi. Professor Gupta is also the chairman and member of Institutional Ethics Committee of reputed institutions like IIT Delhi, ILBS Delhi, and Medanta, as well as AIIMS Delhi. Thank you so much, Dr. Y.K. Gupta, for joining us today. We are joined by Dr. Nissan Jain. He's the program director of German International Corporation, GIZ. Dr. Jain is a thought leader in the field of health systems, health finance, and health insurance for past 16 years, and has demonstrated expertise across countries for the areas of program management, health system reforms, quality and public-private global partnership, and monitoring and evaluation. He's currently heading the bilateral cooperation program for strengthening health systems, health financing, and health insurance through support to the government of India and various state governments. And he's also advising government of India on design and implementation of Ayushman Bharat PMJ scheme, and was also part of the team or leading the team that helped the government in putting together the Rashtriya Swasthya Bima Yojana RSBY in India that covered 140 million population and has been appreciated world over, and actually was the scheme which was there before PMJ. We are also joined by Dr. Sudhakar Sinde, CEO of State Health Assurance Society from Maharashtra, and Dr. Hema Divakar, CEO of Artist Asian Research and Training Institute for Skill Transfer. Dr. Hema Divakar is one of the very vocal and frontline champion of women health in our country. She has been the president of FOXY, the apex body of over 38,000 gynecologists of our country. And she is also the FOXY ambassador for FIGO, the International Organization of Gyne. She is also the member of ISW Council Apex Board. So thank you all, our esteemed panelists of this morning, and also the panelists who have joined from the next sessions, Mr. Ravi Bhatnagar, as well as Dr. Priya Balu. Thank you so much for joining, all of you. So let me begin. By the time I think Dr. Nishant is going to join. So is Dr. Nishant with us? I think he's still not. Okay, so let me start with Dr. Y.K. Gupta. Dr. Y.K. Gupta, you are the veteran of India's public health system. You are heading two aims. And, we know that for people who cannot afford the private, which is the kind of hallmark of quality healthcare or the global standard healthcare in our country, have to go to the government hospitals and have to depend on the government support for seeking health. Ayushman Bharat scheme, which came in 2018, has kind of revived that long-standing dream of getting universal health coverage, and that to quality healthcare because of its public-private partnership model. And we or a person who is beneficiary of that scheme can even walk into a private hospital and get a healthcare which can cost up to 5 lakh, which is a big number for India. How do you see this scheme, and what has been your kind of experience in this last 2 years, that how it is becoming a game changer in terms of making people afford quality health, but at the same time not go bankrupt because of it? Dr. Gupta, you are on mute, I think. Yeah, please. Dr. Gupta, can you unmute yourself?
Yeah. I would give one example of my driver whose son suffered from, he wanted to have a transplant of a valve, and he would have definitely not survived otherwise. And he was in front of my eyes, he was the witness of this transformation. He went to a private hospital, I will not name, because initially there was some reluctancy, but he got admitted and got treated and got best of the treatment what he deserved, and is now one of the happiest person. He is not only fan of me because I advised him, he is now bhakt of our Prime Minister who introduced this. I must say that there may be thousands of such people who got suddenly transformed, whose child, mother, parents, brother, or himself got advantage because of this change. I would say that initially there was a reluctancy by the hospital to adopt this because there was some logistic, some apprehension. Still, people believe in some state governments, still people believe that this is may not be effective. But people are realizing that through this, you and every citizen had the right to get the best of the treatment. And that is the basic fundamental right of the person. And in this direction, we are also working. In fact, I am chairman of National List of Essential Medicine. We have to have the medicine which are affordable, which are quality, and which is available at all the places. And that's why the government of India is making all efforts to make the drugs available, affordable, and also devices. That is also under my chairmanship. We are looking at the devices, maybe the implant, maybe the knee joint replacement, or maybe the cataract implant, or maybe you do any dental implant, and then you maybe the devices and the public hygiene, maybe the sanitary napkins. These are the things which each and every individual in the country should have in adequate amount at affordable price at all the places. The innovation must survive. The incremental innovation is must happen, but basic necessity is the fundamental right of every citizen. Over.
Thank you so much, Dr. Gupta, for highlighting such a, I think, uh, live case study of your driver, where he could afford a quality health care because of this scheme, which converted him into a bhakt of our Prime Minister as well. But I think that much bhakti is enough, good, because if you are getting that kind of support because of a step, it's wonderful to understand. But the point you have highlighted very well is that apart from this, I think there is a need of a lot many things which are from hygiene to preventive care to many other things. So let me so I'll come back to you if we get a time, but you people can take a little bit more time to explain, because it is going to be more of a address format of this session. So let me go to Dr. Ambrish Mittal on this. Dr. Ambrish Mittal, you are taking care of a disease where the prevention is something very, very important. Prevention, and many other cure which has to be there at the primary level, also to diagnose on time, to prevent on time. How do you see that while this Ayushman Bharat, of which you are in the council of advisory council, how it is bringing that secondary, tertiary care, but are we somehow missing on the preventive side of it, that the another important wheel of this Ayushman Bharat vision, which is health and wellness centers? How do you see the overall this scheme unfolding at the both level?
So, how much time do I have to answer?
And take your time.
No, sometimes it's just being clear. So I'll make a few points. I think thank you very much for inviting me here. First of all, I'm delighted to be in such distinguished company of very well-known people. And actually, we look at it from both ends. You see, when you see healthcare, it's like a stream. It's like a stream that starts, at the beginning, upstream care, and you keep going down, it is downstream care. So you can approach the problem from both ends. You can approach it from the upstream measures or downstream measures. So when we talk of Ayushman Bharat, which is a unique pioneering sort of project of the government, which has attained remarkable success in the short time span as it's been brought out, and we are primarily looking at treating disease. The focus of Ayushman Bharat, the primary focus, the first focus, and then there are other things as you were talking about. But the primary focus is to provide treatment to people who would not have had access to that treatment earlier. And that is the primary goal, and in which it is succeeding. There is a lot of scope to go, but there is undoubtedly initial success, and it needs to be built more and more with more defense safety mechanisms, with more monitoring, with more expansion, so that kind of thing. So undoubtedly that is the key difference between Ayushman Bharat and other previous schemes was the involvement of the private sector. I think the truth of the matter is, whether we like it or we don't like it, having worked extensively both in teaching, full-time teaching institutions and in the private sector, I can say that undoubtedly over the years a gap has happened in terms of quality of care. Now, sometimes when we think of public sector, we think of AIMS Delhi. But that is not a good example. I mean, that is our apex institution. We are all products of that place, and that's not a good yardstick to judge the public sector care by, because that's one institution. Okay, we have to look at public sector care that is reaching the remote parts of India. And I think there, definitely the public sector care, quality of care has to be pushed up. So any government which is now trying so hard to provide quality care to its citizens has to make sure the public infrastructure is built up so that this gap is narrowed. And we can have a very clear distinction. We can have a clear distinction of having really good primary and secondary care in the public sector, and then work towards tertiary. We have to keep tertiary care open, of course, and all these new AIMS and all will add to that. But the fact is that our primary and secondary care has to be the responsibility of the public sector in some way. So unless we strengthen that, we'll always be juggling between private, public, and there will be adversarial rather than cooperative, sort of things. If we can say that a gallbladder surgery can be done in any government hospital at a reasonable cost and with high quality, acceptable quality, fantastic. A lot of your things are covered. What I'm saying is that this secondary and tertiary thing has to be clear, that we should not lose sight of the fact that government health structures should be working also towards strengthening, which they are, of course, but should be focusing more on strengthening our primary and secondary structures. In the tertiary, in the Ayushman Bharat thing, yes, there has been a whole lot of increase, but we have to understand that the costs of tertiary care are very high. And to make it sustainable is going to be a challenge. There's no doubt about that. There have to be ways, both ways. We have to reduce the cost of tertiary care by indigenous implants and devices, etc. And as Professor Gupta was saying, if you're doing a knee implant, and if every hospital is buying a few knee implants, and their negotiation capacity is very limited, but if one is selling to the government, as they do in Germany or NHS in England, then you can get the prices down very substantially. So prices of devices and consumables have to come down, and that's where government is trying a lot. I know NHA is also trying a lot to bring those down. That will reduce the cost of tertiary care. We just see those big costs. We don't realize the whole chain that happens in between. So cost of reduction of tertiary care is one of the very laudable goals. Otherwise, this gap will continue, and it'll be very, very hard for our country, which is trying so hard at this stage and facing the pandemic and everything, to be able to deal with tertiary care and subsidize all tertiary care, or reimburse all tertiary care is going to be a big challenge. Okay, so that is one thing that I thought is important. And coming back to your point about primary care, and I think that's important. Primary healthcare delivery in India has improved, but not much from the time I was an intern, and Professor Gupta is there, Hema is there, they can all vouch. It really hasn't changed that much if you go to grassroots. And that is unfortunate. So when you see these horrible stories on television and then you say, this is what I've seen all the time, it doesn't come as a surprise to you. So primary healthcare is one of the pillars of the Ayushman Bharat, but it's not one of the things that has got focused so far, although it's listed there. I firmly believe that primary healthcare is very, very important in determining our success, because ultimately, if we want to reduce the burden of cost for tertiary healthcare, unless our primary healthcare is good, we will never succeed. And moving a little more proximal, little more towards the root, then you say wellness. Primary healthcare is still some disease, but you talk of wellness. So wellness is health and wellness, and we know that very well. And I think it is without that, unless we do all this simultaneously, we'll be expending a lot of money on the tertiary care with all our effort. And it will not be, at some point, it will catch up with us. So our focus has to be on our primary health centers, our primary health care, and moving even further up at the root of the problem. Where does it start? I was saying we are going from downstream to upstream. We are going from the part where the river meets the ocean, that is the tertiary care. And we are actually going up to secondary and then primary and then to the source. The source is healthy air, clean water, and healthy food. Now, if any country like ours, which is one of the fastest rising countries in the world, if we have to have make an impact globally and help our people, we have to make sure that there is no malnutrition. We have to make sure there is clean drinking water, and we have to ensure that we just don't see this worsening of air quality that is happening all the time. The lockdown told us how much of it is man-made. Moment there was a lockdown, I saw such skies that I had never seen before. So, or saw as a child. So what I'm saying is that it is important that, and the last part, that is the health, the air, water, food, that requires more than the health ministry. It requires a lot of other people to collaborate and everyone to collaborate. So let me take the example of nutrition again. Okay, nutrition is we still have above 35% undernutrition in children. 35%. One third of our children are still not getting enough nutrition. On the one hand, our life expectancy has gone much, much better. So something we are doing right. On the one hand, our modern medicine technology competes with anyone in the world, right? We have the best surgeons, the best physicians, the most skilled high-end stuff. On the other hand, 35% of our population is still malnourished. Well, they will get good care in Ayushman Bharat, but we have to also make sure that they're not undernourished, right? So the potential of the population cannot be realized optimally till these things are addressed. So this is macronutrition. Macronutrition meaning protein deficiency, calorie deficiency still exists in so many parts of India. And really, that is, I know it's a focus already, but we need to push more and more, whether it requires more finance, whether it requires more inputs, more human resource, whatever it is. It's not an easy challenge. Yeah? It's not something that can be done overnight, but it requires a lot of inputs in that regard. So I think we need to look at it from that point of view, that if we are trying to improve the health of the country, these things have to be taken into account. I'll give you an example of one of the uh, uh, sort of more successful drives here. That if we talked of macronutrients and protein malnutrition and deficiency in children, what about micronutrients? Vitamin A, iron, vitamin D, which is one of my major passions. So many things. There is an excellent fortification program that has been initiated by the government. As late as 2016, the standards were set, and gradually it's changing. And even the other day, I was in a conclave of the Food and Safety Standard Organization of Association of India, and we actually, I was really delighted to see that more than 40%, I think 47%, forgive me, it's 45, 47% of the branded milk that is sold in India now is fortified. So, and this is in less than 2 years. So I'm sure in a couple of years, at least all the milk will have enough vitamin A and D to take care of so many of these things. Similarly, in midday meal programs, rice is being fortified. Milk, so it is just spreading like this. So I think I see in 3 years that a lot of the micronutrient deficiencies will be attenuated to some extent, at least, if not taken care of. So, we have to, as I said, act on multiple levels. Only then we can really get into this whole thing. And again, coming back to Ayushman Bharat per se, I would say that the private-public partnership model is amazing. We have to engage more and more. Now, sometimes when we sit on one side, we think of the other side as completely, talking something that is irrelevant both ways, because I have sat on both sides. And actually, the truth is, as usual, somewhere in between. The goal of the healthcare system, private or public, is to take care of patients. That is our goal. There's no confusion about that. So
Thank
I
you so
think
much.
that's how I would look at the whole thing.
Thank you so much, Dr. Mittal. And I may like to come back to you, on the public-private partnership. You are somebody who is also, practicing at the private level, and those concerns which come up, hospitals or among even the doctors sometime because of certain aspects of the design of Ayushman Bharat. We may, if we get time, we will talk on it. But let me go to Dr. Y.K. Gupta again. since his remark was very brief, and then I'll go to Dr. Nissan Jain. Dr. Gupta, you are there?
Yes, yes.
Right. So Dr. Gupta, Dr. Vittal has very, aptly highlighted about that this whole primary health space has not moved much, while we are seeing a wonderful, focus, mission mode, work on the area of secondary and tertiary care. I think that gives a better showcaseable result also. Somebody gets a heart attack and gets treated without spending money, gives a wonderful case study. But what about somebody who is, kind of chronically malnourished and getting into or adding to the health, the disease burden, and we are not able to keep our healthy people healthy at multiple level, which Dr. Mittal also said. So what is your opinion, being a veteran in the public health and also especially the public funded health as well? You are taking care of two aims where, all, the patients try to converge in every AIMS. Delhi has been that, kind of converging point. I'm sure all these aims will also become the center of excellence at their own level and will start delivering the similar quality of health. But what about the primary health? What is your opinion on that, and how we make that as the focus of Ayushman Bharat?
I fully agree with what Amrish has said. And if you just see, when I was active in AIMS Delhi as a dean and as a professor and also member of several committees, what we observed was majority of the public in Delhi or even outside Delhi, different aims, many people come of minor ailments, which could have been managed, which could have been treated at the primary center or the secondary center. And this basically makes a crowd at aims or which are meant for traditionally a referral hospital, and that takes a significant amount of the load of the clinician and depriving the care which the tertiary care hospital is meant to give for the specialized or the complicated cases. So now, if you just see the analysis, perhaps the primary health care setup is not equipped or not functioning as it should have been. The entire primary healthcare setup or the Indian healthcare system now is gearing to upgrade that and upgrade. And that's why you see there are so many medical aims are coming, 26 aims are coming that will offload, that will have the percolating effect on the district hospital, that will have the percolating effect on the primary health center. Still, the facilities to the medical profession, to the paramedical profession, which they should get in the primary health center, is now differential. That should improve. That will improve their state. That will improve their affinity to that population, and that will improve the dedication. Just say that you go there and have a dedication. I think that will work better if they are provided good facilities. The infrastructure in terms of a medicine availability at the primary health center, and that's why we have created a essential list of medicine which classifies as the P, S, and T. P means those drugs which must be available at the affordable cost and quality at the primary health centers. The S means those medicines which should be available at the secondary health care center, and those medicines which must be available at the tertiary health care center. And therefore, these are and we are also dividing this in terms of devices, in terms of public hygiene products, that these are the basic fundamental devices which must be available at the primary health center, secondary, and this list will be out, and then the government will make sure that these devices are available at the primary health center. The important issue sometimes also comes about the quality of the medicine which is available at that place, the public awareness of the medicine. And I must say that today, Corona is in pandemic. Tomorrow, there is another pandemic in the box, which is antimicrobial resistance, AMR pandemic. So many people are taking antibiotic, go into villages, no prescription, Every antibiotic is available at the chemist shop. So primary health center, secondary health center, even in the tertiary healthcare center, the rampant use of drugs, particularly antimicrobial agents, is a disaster. And that happens because the education awareness in the people about the use and misuse of the drug, awareness in the chemist about the law and the law enforcing agency, and also in the tertiary care hospital where there is a people want to give a shot of the drug and then they think that this will be the best for the patient, but this will ultimately be the disaster for the society. Another important thing I would say that we should, how much time we create in our video, TV, and if I see the slot of the advertisement, negligible for creating awareness about health and health related issues in primary health center. I think that should also be faster. And I fully agree with that. Pradhan Mantri Yojana and of cleanliness, all those things made a difference, but still long way to go. If you have a preventive measure on just telling them that these are the diseases which can be prevented by simple hygiene, which can be done by everybody, can contribute into that. If there is a punishment, severe, strong punishment, those who violate these simple hygiene discipline. I think why people, Sweden and Denmark and the people are so hygienic, because if they do not follow, they are punished. And if we just say that you do it, request them, it doesn't work. There has to be punishment also.
But
And
there
I
has
strongly
there
believe
has to be availability also before
there has
something.
to be availability, but the no civilian, no society person should be allowed to throw garbage on the road from the house, and nobody should be allowed to pollute the air. Nobody should be allowed to adulterate the food, because ultimately this may. So I think these are the fundamental things which society and the government and the NGOs should work together.
Yeah.
Then only we will achieve.
Thank you so much, Dr. Gupta. Important points. So while we were talking about the primary side, now we have with us the two people who are involved in this whole NHA and PMJ work. We have Dr. Nissan Jain with us from German Corporation. So, Dr. Nissan Jain, you have seen RSPY, you have been and you are advising on PMJ as well. Give us some, because the audience today would also like to understand what the PMJ has already achieved and how it is going to unfold further. And also in terms of how this whole National Digital Health Mission is also going to have a little more boost up for this entire mission of ensuring that at least people who require secondary and tertiary care are getting it when they need it.
Thanks, Kamal. Thanks, and thanks for inviting me. And nice to see all the distinguished panelists. Dr. Mittal, nice to see you again. So, as you rightly said, Kamal, that Ayushman Bharat is a big initiative by the government, very ambitious. And of course, it's only a little bit more than 2 years which have passed for the scheme. But in the small time, it has achieved quite a lot. It would have achieved much more because of, we all know the situation since past 6 to 8 months, what we are facing. So of course, everything got impacted, including the scheme implementation. However, I will still say that the trajectory of the scheme have been quite good. So when we started with roughly 28 odd states, and now barring 3 states, all the other states have agreed to join the scheme. 1 state has not yet started the implementation, but rest of the 32 EU states and union territories are already implementing the scheme. And as you also know that we in the past roughly 1-2 years, we have now more than 1.3 crore treatments which have taken place under the scheme across various states, and claims worth, I will say, more than 16,000 crore rupees have been raised under the scheme. So in terms of numbers, it's good. In terms of we have more than 24,000 hospitals empaneled under the scheme, which means roughly 11-12,000 are private hospitals out of that. So if somebody sees from a bit outside, just the big numbers, things looks quite good, and they are good. But of course, there is a need for a lot of improvement also. So for example, that even though we have reached more than 1 crore, but I think that keeping view the hospitalization rate in India, the need for the hospital treatment, it can be much more. And what we had seen that before, just before COVID, the way things were going, we would be doing almost more than 1 crore hospitalization every year. But of course, it came down drastically, and now it is again started picking up. So on an average, I think we have reached almost 70–80% of the pre-COVID numbers already. And I hope that in the next few months, things will be much better. And also with the announcement of vaccine and all coming, I think that things will be improving much more in terms of getting the numbers right. In terms of the engagement with private hospital, what Dr. Mittal was saying, for example, this public-private partnership becomes very important. But I think one of the challenges which still Ayushman Bharat faces is bringing much more private hospitals in its network. So the smaller and medium-sized hospitals are much more in the network rather than the very big ones. So some of them are there, but many of them are still not there. And that's where I think the challenge is, that how do we bring those hospitals, what are the bottlenecks or what are the inhibitions they have regarding the scheme? Is it regarding the rates which we are providing to the hospital for treatment? Is it regarding the claim payment, if there are any delays they foresee, or is there some previous experience which they had, which they didn't like, and that's why they are skeptical? So we have to think in all those lines, and then only we can actually see that how do we bring those hospitals in. So that is number one. Number two, that in a country like India, where especially for the poor and vulnerable, which are being targeted through PMJ, is another challenge, that how do we actually bring those kind of population, make aware about the scheme. So even if they are covered, because unlike RSPY, which was an enrollment based scheme where you need to have a smart card before you can go for the treatment, this is an entitlement based scheme, which means that if you are in the list, you are covered. But how do you know that whether you are in the list or not? Sitting in some village in some state, you may not be aware, and suddenly you are covered now under the scheme. And unless somebody will come and tell you, it becomes very difficult. Even if somebody tells you, you may not feel very confident in entering a big hospital, because you think that maybe they will throw me out. I don't know whether they will ask money or not. So that is why it's very important that not only people become aware, but they are also told about their rights, that, if there is any problem they face, where they can complain, if there is any issue, where they can go, all these things. And that is why it's very important that Ayushman Bharat took a decision that now we'll start issuing these e-cards proactively. So earlier, the idea was that only the cards will be given when a person reaches a hospital, because before that there was no need, but person was anyway covered. But now government started this proactive card issuance, where people will get the card in advance before they go to the hospital, so that they have a piece of paper in their hand and they feel more confident that, you see, I have this Ayushman Bharat e-card, so when I will enter an empaneled hospital, they will not drive me away or something like that. So that is very important. So that proactive enrollment and issuance of card has started. Of course, that does not mean that if you don't have card, you can't go. You can still go if you're eligible. But the issuance of card is very important, and some states have done remarkably well, and many other states are still catching up. But I think that in next 6 months to a year, a large percentage of Ayushman Bharat beneficiaries will get these e-cards, which will help a lot. So I think this is and then this awareness building comes into picture. And I think, like what government did, like with Jan Dhan, or with Swachh Bharat, these kind of big, I think, campaigns needs to be done. And I think organizations such as yours and many others can play a very important role, because it's not only government which needs to do, it has to become a movement. People will need to understand that they are covered. And one of the very gladdening thing I will say has happened under Ayushman Bharat PMJ, that many states have already expanded the scheme. So in theory, we cover roughly 50 crore people. But because of the expansion by states they have already done, we cover more than 65 crore. Already people are covered under the scheme. And that too, when 3 states, big states, West Bengal, Telangana and Odisha, are not in the scheme. So if they will come, maybe we'll reach 70 crore or so. So that is a good thing, that so many people are already covered under the scheme. But at the same time, whether we have enough healthcare providers in the network to provide them the treatment, number one. And number two, that even the treatment which is being provided, is it of good quality or not? So some hospital may provide better quality, some hospital may not. And that's where the whole idea where Ayushman Bharat is trying to work on, trying to have NABH accreditation for the impaneled hospital, trying to see some kind of grading system to work with NABH to come out with a grading system so that hospital have some motivation to improve their quality. Also, what is being done to come out with standard treatment guidelines. That is something again on which people are working, so that for each treatment there is a pathway which is their guiding pathway which can help again. So those kind of things we are working on, but of course it takes time. It's not an easy thing to do. And you also talked about NDHM, National Digital Health Mission. So this is, even though it's completely separate from Ayushman Bharat, but since NHA is working on both of them, there is a lot of overlap, because under Ayushman Bharat, every patient gets a patient ID. But under NDHM, unique health ID has to be given to every citizen of the country. So that can become the base. Similarly, every provider will get a unique provider ID, a hospital, a health provider ID under NDHM. Ayushman Bharat gives his own ID. Ministry of Health has something called NIN, they give their own ID. IRDA has something called Rohini, they give their own ID. So instead of all these various health hospital ID, there'll be one ID given by NDHM. That will be very good. And also creation of electronic health records, which will come. So I think NDHM is a very good step towards that. But as we have seen in case of Aadhaar, it's easier said than done, because Aadhaar was just issuing one number to every citizen of the country. And that itself took so much time and effort, and still we have not reached 100%. So assuming that this national health ID will start going to the people very easily, and in the next 1 year we'll be able to achieve, is not an easy thing to do. So that's where we have to be quite innovative in that, and try to link with various schemes, like PMJ can be a good platform to do that. Similarly, other schemes like ESI or CGHS or other government program, all of them have to be linked. Then this NDHM can actually make much faster progress in terms of achieving its objective. So I'll stop here, Kamal, and then maybe we can talk later. Thank you.
Thank you so much, Dr. Jain, for giving, I think quite assuring information about how PMJ is contributing substantially, and definitely, as you and that's good to hear that you yourself is saying that there's a long way to go to actually achieve what we intend, or what we, the country need to achieve. We have Dr. Sudhakar Sinde, CEO of State Health Assurance Agency in Maharashtra. So, Dr. Sinde, you are there? He's connected, but Dr. Sinde. Okay, so let me go to Dr. Hima Divakar in between. Dr. Divakar, so you heard, I understand that your passion area is that women's health, and that the women of our country, which is, let's say, 50% of our population, should get everything from primary health to wellness to good maternal care to for all the diseases which may follow as part of NCDs or any other infectious disease. How do you see, as a champion of women's health, how do you see Ayushman Bharat contributing this thought, this scheme, these big numbers, which 24,000 hospitals impaneled on Ayushman Bharat, 1.3 crore I think hospitalization has already happened, and almost 16,000 crore rupees worth treatment has been provided. How do you see, as a healthcare provider, as a women's health champion, how it is helping that, and what do you expect further from it?
Namaskar. Thank you, Kamal, for this kind invitation and the opportunity to place some of my thoughts and action points in front of this esteemed panel and the audience as well. As you rightly remarked right at the beginning, Ayushman Bharat resonates so well with our ancient philosophy of Ayushman Bhava. Okay, so in keeping with the same tone and tenor, I would say that another cliched ancient saying is Sarve Janaha Sukhino Bhavantu, which also goes towards universal healthcare. Okay, that's what it really means, because Sukha is like health, and health is wealth is always what we've been seeing and saying, and the taglines that we have often used. prevent illness and promote wellness, okay, and passion for quality healthcare. So moving with these in alignment with what our government in general is trying to do, I would really like to say that yes, the vision of accessibility and affordability is in the right direction, but the supply side, that is the very first reason I wanted to connect and collaborate with IHW Council, if you remember, is Integrated Health and Wellbeing Council. That name caught my attention, and out of the blue, I just got in touch with you because I said, Kamal, we have to make the 150,000 health and wellness centers actually functional. From some innovative ideas, let's move towards implementing that. And that is the track I have been again and again urging you to help us, collaborate and follow the track. Having said that, again, the National Digital Health Mission, it's a wonderful opportunity for us as healthcare providers to task shift, to build the capacity of the frontline healthcare providers, which will truly make this Ayushman Bharat Wellness Centers really move forward. I think I can see your signal saying that maybe Sudhakar has joined or Ashwini Chaubey ji has joined, because he always says we'll put Dr. Hema Divakar in between, and I'm happy to come and go in between. Yeah, please come in.
Dr. Divakar, I'm so sorry.
Not an issue.
See,
I'm always there.
Today is a very unique day. We are going to get our new parliament building, and the Prime Minister is laying the stone of that at 12:30, and most of our guests, the ministers, honorable ministers, have to attend that. And so we are now joined by Honorable Minister MOS, Minister Social Justice and Empowerment, Sri Ramdas Athavale. And thankfully he joined us again on this second edition. He was our chief guest when we initiated this conclave in the last year, along with Dr. Indu Bhushan, the CEO of NHA. So may I request the team at Honorable Minister's office to switch on the camera. So, Honorable Mantri ji, good morning.
Namaste ji.
सर आई नो अभी आप जस्ट एयरपोर्ट से घर पहुंचे हैं, और आई एम सो सॉरी फॉर काइंड ऑफ प्रेसिंग इनटू योर टाइट शेड्यूल दैट टू अटेंड आवर दिस कॉन्क्लेव टुडे, बट एज आई नो दैट यू स्टैंड फॉर all that is needed to be ensured for our downtrodden, our people who cannot afford health, who cannot afford wellness or any other part of, and you firmly believe that health is the part of social justice. If we can't make our people at all strata healthy, we can't provide them that social justice which our constitution actually promises to provide each and every individual of our country. So thank you so much for joining. I will definitely wait till the time you finish your tea, and I'm really sorry for kind of making you juggle with multiple things in this morning.
एक मिनट
जी सर. We will be joined hopefully by Sri Ashwini Chaubey also. Sir, good morning.
Good morning, Kamal Narayan ji. Good morning.
So I request to kind of grace this occasion with your kind words, and also the audience who is watching, your vision that how the government of India is helping the poor of our country with this Ayushman Bharat scheme.
तो आज जब आयुष्मान भारत कॉन्क्लेव के दूसरे संस्करण में आज आप सभी के बीच या आने से मुझे बहुत बड़ी खुशी हो रही है. मैं इंटीग्रेटेड हेल्थ एंड वेल बीइंग काउंसिल और मुख्य कार्यकारी अधिकारी श्री कमल नारायण को इस ऐतिहासिक योजना पर चर्चा जारी रखने के लिए धन्यवाद देता हूं, जो सबसे गरीब भारतीयों के लिए फायदेमंद साबित हुई है. 2018 में लॉन्च होने के साथ आयुष्मान भारत के 50 करोड़ से अधिक लाभार्थियों को सस्ती और सुलभ स्वास्थ्य देखभाल का वादा किया था। भले गरीब लोग भारी भरकम बिलों के डर से निजी अस्पताल जाने से डरते थे, आयुष्मान भारत ने यह सुनिश्चित किया है कि लोग अपनी पसंद की सुविधा पर स्वास्थ्य सेवाएं प्राप्त कर सके। यह जमीनी विकास है। नियमित स्वास्थ्य जरूरतों के साथ गरीबों की सेवा के अलावा आयुष्मान भारत ने कोविड-19 महामारी के बाद से एक महत्वपूर्ण भूमिका निभाई है। उन्हें सस्ती स्वास्थ्य देखभाल तक पहुंचने में सक्षम बनाकर जहां भी वे कृपया आयुष्मान भारत ने सामाजिक न्याय के एक उपकरण के रूप में खुद को मजबूती से साबित किया है। मैं एक और साल के लिए ISW काउंसिलिंग के आयुष्मान भारत कॉन्क्लेव में वापस आने से बहुत खुश हूँ। मैं पिछले साल भी इसके उद्घाटन संस्कार में मौजूद था। आयुष्मान भारत की सफलता से पता चलता है कि सामाजिक न्याय हमारे लिए प्राथमिकता है। हम यह सुनिश्चित करने के लिए कड़ी मेहनत कर रहे हैं कि प्रत्येक भारतीय को उत्पादक जीवन की आवश्यकता हो। यहाँ तक कि एक स्वस्थ भारत की दृष्टि को साकार करने के लिए महामारी को चुनौतीपूर्ण समय में भी मुझे बताया गया है कि आज कई विषयों पर चर्चा की जाएगी। मैं राष्ट्रीय स्वास्थ्य प्राधिकरण के शासी बोर्ड के सदस्य डॉक्टर अमरीश मित्तल, अखिल भारतीय आयुर्विज्ञान संस्थान एम्स भोपाल के अध्यक्ष डॉक्टर प्रोफेसर YK गुप्ता जी, जर्मन इंटरनेशनल कॉरपोरेशन के कार्यक्रम निदेशक डॉक्टर निशांत जैन और एशियन रिसर्च एंड ट्रेनिंग इंस्टीट्यूट फॉर स्किल ट्रांसफर की CEO डॉक्टर हेमा दिवाकर को समय निकालने के लिए धन्यवाद देता हूं और विचार विमर्श के लिए यहाँ मैं मौजूद हूँ। मैं श्री कमल नारायण जी को भी धन्यवाद देता हूँ। उन्होंने अपना समर्थन जारी रखा और कॉन्क्लेव के लिए शुभकामनाएं देने के लिए आज मैं यहाँ मौजूद हूँ। आप लोग जानते हैं कि आयुष्मान भारत योजना माननीय नरेंद्र मोदी जी ने गरीबों के लिए, मिडिल क्लास के लिए, या जो लोग इसके कैटेगरी में बैठते हैं, ऐसे लोगों को एक साल में एक फैमिली को 5 लाख रुपीस देने का ये प्रोग्राम है और इससे बहुत सारे लोगों की जान बच सकती है। बहुत सारे हजारों लोग बिना पैसे से अस्पताल में भर्ती नहीं हो पाते थे, लेकिन अभी उनके पास 5 लाख की गारंटी है और कोई भी अस्पताल में उनको भर्ती करना ही चाहिए। और बाद में अगर जो बिल होता है 5 लाख में, जो लाख, 2 लाख, 3 लाख जितना भी बिल होता है, वो बिल डॉक्टर को आयुष्मान भारत योजना से मिलता है। इसलिए आई एम वेरी प्राउड because Kamal Narayan is also a very active personality and always he is also helping to all. And my ministry is social justice and empowerment. My ministry is also not health ministry, but my ministry is also giving the social justice to the poor peoples, the scheduled caste peoples, the DNT peoples, old age peoples, disabled peoples. And my ministry is also very active, working for all. Near about 80% population is controlled by my ministry. And therefore my ministry's budget is this year's 2021 budget is near about 85,000 crore rupees. And disabled department's budget is 9,500 rupees. And therefore my ministry is also helping to all poor people, orphan peoples, and our ministry is also supporting Mr. Kamal Narayan. Kamal Narayan is also my good friend, and always he is also coming to my office, discussing many problems. But health problems is also a very important problem. You know that in this COVID, is COVID-19 is very dangerous, and COVID came from China to all over the world. And on 20th February 2020 in Mumbai, in near Gateway of India, near Taj Mahal Hotel, there was one starch march with the ambassador of China, and I was present there. At that time, I have given the slogan, "Go Corona, go Corona, Corona, go Corona, go." That slogan was very popular. That slogan was went in all over the world, all over India. But when I have given the slogan, "Go Corona," but on 27th November, the Corona came to me, and I was admitted in the Bombay hospital near about 11 days. And then I came from the hospital after 11 days. But now I am okay. And every day I am giving the slogan in the Bombay hospital, "Go Corona, go Corona," and Corona go. Corona went from me. And therefore, in these very difficult days, we are also fighting against Corona. The vaccine is also coming now, and the India will be a very strong country to provide the vaccine, because there are 3 institutions in Pune, Hyderabad, and Ahmedabad. There are 3 institutions that are also producing the vaccine, and our Prime Minister is also very serious on this issue. And if the vaccine will come, then the death percentage will be come down, and Corona's percent should be come down. Now Corona is also coming down and down, but the Corona is also there, and therefore I'm not going to take your more time, because today there is the function that the new Parliament building near, you know that, where Mahatma Gandhi statue is there. And the behind Mahatma Gandhi statue, there is a reception hall. Another some activities are there, but the new Parliament building will be there, and therefore today our Prime Minister is also going to Bhumi Pujan of this new Parliament building. And therefore now I came from Mumbai first time after 1.5 months, and I am going to attend that function, and therefore I'm not going to take your more time. But this seminar is also very important seminar. Kamal Narayan is very nice personality, very active personality. Always is also inviting you, and very important discussions are there every time. And health is very important, because health, there is no good health, and therefore health should be there. If we are powerful, then nobody should touch us, and therefore as our body, our health, as India's health is also very strong. Therefore China is not going to touch India, because India is also very strong now, and therefore our body should be strong. And but now I lost my weight in this Corona time, the lockdown time, near about 18, 19 kg, because I was going to exercise, and therefore now I am attending this your webinar, and therefore thank you very much. All the activists are also present here. Mr. A.J. Reddy, Himani Singh,
Dr. Sudhakar Sinde is also with us, who is
Dr. Sudhakar Sinde is from Maharashtra. He is from Mumbai.
CEO of Maharashtra State Health Assurance Agency.
Chandrakant Laharia, Ravi.
Ravi Bhatnagar ji is very important personality in the area of hygiene and wash. He is the head of Dettol, the company which make Dettol, and he is very active in providing hygiene and preventive things for the society, and especially the children across the country. So very active person in the area and very big contributor of the health of our country.
Yeah. And another Amrish.
Dr. Amrish Mittal, he is the member of governing council of NHA, the agency जो आयुष्मान भारत को इम्प्लीमेंट कर रही है सर, उस एजेंसी को गवर्निंग बॉडी में डॉक्टर अमरीश मित्तल हैं. वो प्रेसिडेंट भी हैं गोरखपुर एम्स के, और भारत के सब बहुत बड़े एंडोक्रोनोलॉजिस्ट और डायबिटोलॉजिस्ट हैं. मेरी पत्नी भी इनकी पेशेंट रह चुकी हैं, और मोस्ट ऑफ द पीपल जो है जिनको डायबिटीज होता है वो दे एस्पायर टू गेट द सपोर्ट एंड कंसल्टेशन ऑफ डॉक्टर अमरीश मित्तल. डॉक्टर वाईके गुप्ता हैं, ही इज द president of AIMS Bhopal and also AIMS Jammu, which is in Samba district or sector. I hear Samba sector always in a terror and the other military related stories. We have Dr. Suchin Bajaj also. Cygnus Ujala hospital chain है, गरीबों के लिए hospital chain है, उसके founder हैं डॉक्टर सुचिन बजाज, और बहुत सारा काम करते हैं. जिन लोगों को वो हेल्थ केयर नहीं मिलती या आयुष्मान भारत आने के पहले भी उन गरीब लोगों के लिए इन्होंने हॉस्पिटल्स बनाए. और डॉक्टर हेमा दिवाकर, सो थैंक यू सो मच ऑनरेबल मंत्री जी. और आप नेचुरल फाइटर हैं. आपने कोरोना जब आया था तब कोरोना को जाने का जो है मैसेज दे दिया था, और कोरोना आपके पास भी आया और उससे भी आपने अपनी फाइट को कंटिन्यू रखा है. And I'm sure that you will have a wonderful health going forward.
Kamal Narayan ji, I am not only fighter, I am writer also.
Wonderful. So that we always get to hear, but today I did not get that one-liner or two-liner couplets from your side.
हाँ सर, आज कविता नहीं सुनाया आपने.
कुछ नई पार्लियामेंट के लिए, नए भारत की नई पार्लियामेंट पर आप सुना सकते हैं. वो that will be the right time.
तो मतलब जो प्रधानमंत्री जी ने शुरू की है योजना भारत आयुष्मान, प्रधानमंत्री जी ने योजना अनाउंस की है भारत आयुष्मान, इसलिए गरीबों के मन में आ गई है जान. हमें बढ़ानी है गरीबों की शान, हमें बढ़ानी है गरीबों की शान, इसलिए सब लोगों का है आयुष्मान भारत की तरफ ध्यान. तो ये मैं बताते हुए.
Wonderful, sir. Thank you so much. These lines, capture the whole thought and vision and the emotions of Ayushman.
इस समारोह का सफल कर दिया.
Thank you so much. So this was Honorable Minister Sri Ramdas Athavale. He is very kind person and has always been gracing and helping ISW Council in having our own or driving our efforts to achieve better health and well-being, or demand for it for the public. We don't provide health, but we just demand for it. So at least that is also important, and we make people aware that when and why they must seek health when they need it, and they must be provided health when they need it. So Dr. Hema Divakar, I'm sorry I kind of interrupted in between. Please, you can continue your thought about how Ayushman Bharat also has to make our Ayushman women.
I think all the stalwarts here will agree that there are bound to be many interruptions in the form of challenges, which we use for opportunities to connect and collaborate. So I'm happy to place the last bit of the thoughts when Kamalji said that she is very vocal. So I would say go vocal for local, because Nishanji just said that we must have set protocols. Being an ambassador to the international community, we have set up a scheme of things which says East meets West, because everything that happens in the West, contextually, the feasibility in our part of the world is not the same. So we have to devise what is feasible, what is pragmatic, what is practical, what is doable in our context. And therefore, through FOXY, through FIGO, for women's healthcare, we have aligned a set of very simple and very doable at every level of healthcare. So that in the previous discussion on cancer cervix as well, I had said to the Vipul Agarwal, I think from Ayushman Bharat, that if the primary care of screening and vaccination is given to the women, then you can treat double the number of women at half the cost because fewer and fewer will present with the advanced cancer initiatives. So as Amrish ji has also said, the primary care is important, but it should just not become another, just a pathway or a passage of people to go by. Ki card yahan bhi use kiya, but they say, no, we can't do anything here. You go to the next center. So that will not work. We have to empower them in a simple protocol based way of what best they can do for the preventive healthcare. And for that, again, going back to our philosophy and the ancient mantra of the Abhimanyu theory, okay, because we believe in women's healthcare space that it all begins in utero, because that is the point where the programming of the next generation happens. And we have tied up with the international organizations for what you call the good air, because the environment inside the uterus and environment to the pregnant women to which she is exposed to a lot of toxins in the environment. So that's a big movement that we are starting with the international community, being sensitive to that fact, and good food in alignment with the Poshan Abhiyan, pre-pregnancy, pregnancy, and post-pregnancy, the good nutrition, because the malnutrition and the under and overweight babies in the women is the seed for the future NCDs. And therefore, a whole tsunami of the unhealthy next generation can be prevented by investing the maximum in the community of women who are embarking or going to embark on a pregnancy, and when they are pregnant, and for a long, long term postpartum, because the pregnant women and the next generation has to. So with these thoughts, I think the segment of women and child healthcare in terms of good air, good food, good health, accessibility, and for as a fundamental right, because it is not a disease process. She is called upon to reproduce, to continue the human generation, and whether in public or private sector, this is one issue which has to be treated and looked upon through the gender lens as well. And in keeping with the SDG Goal 3, good health for all, accessing universal healthcare, and capacity building, which is our passion through our own organization, Asian Research and Training for Skill Transfer. It's not the theoretical knowledge, but actually what they do. So the ART of artist is A for advocacy, R for research, because we need to document and audit and learn our lessons as we move forward, and T for training or capacity building, which we are doing through FOXY in our quality accreditation Manyata initiative, empowering the teams in the hospitals, not only the consultant or specialist cadre, but all the paramedical team who completely understands what they need to do, how they need to do, and why they need to do. Some short, quick fix solutions which can easily be implemented. So another tagline for us is innovation to implementation. That's the gap we need to bridge to have the necessary impact. It is a pledge, once again, Kamalji, to connect and collaborate, whether it be East or the West. We have to be the best. Thank you very much.
Thank you so much, Dr. Hema Divakar. And definitely we need to prevent that tsunami of malnourished or the people who will, kind of develop these NCDs before they actually reach to that level. Dr. Amrish Mittal and Dr. Nissan Jain, just a small remark by the time, the next panel joins in. Like we are doing, Ayushman Bharat PMJ scheme under National Health Authority in a very, very, I think, focused mission mode pattern. How the same can be done for improving, enhancing, and setting up the whole this 1.5 lakh or more than that if needed, these health and wellness center which are functional, effective, robust, and has not only the medicine available but also the required technology or the trained manpower or human resource, or maybe even open up the space for public-private partnership as we are doing in PMJ. How, is there a way to achieve that? Because I think that's where lies the cure for India's healthcare problem. Dr. Amrish Mittal. Sir, you are on mute.
Sorry. So I think there is no doubt, Kamal, that is the way forward, as you rightly said. But I also know that the actual implementation processes really cannot be outlined here. But the truth is that it requires focus now. So it requires to set up a parallel silo in the whole system, which is looking after this. Because the difficult part, of course, was providing care for complex disorders to our public, which is still ongoing and will still has a long way to go, but where we have made considerable progress. So for this also we need to focus, and I don't think it's something that cannot be done. The investments required in this are much less. The finances required in this are much less. It's mainly about setting up processes, and I think the correct processes and a lot of use of technology will go a big way in this. Monitoring lot of it can be done by remote technology now. Remote monitoring can be done by technology for everything. So similarly in this, connecting these health centers to higher centers, as Dr. Hema was saying, but all this, lot of it can be done with the appropriate use of technology and using NDHM like tools to connect. I think this requires much less investment than our tertiary healthcare does. So I think it's just a question of focusing on that. But I will quickly make 2 points before I let you go, because then I will have to leave also. So two quick points. One is I completely endorse what Hema was saying. I think maternal nutrition, in the context of my specialty specifically, undernourished mothers give rise to give birth to children who are more likely to get diabetes and metabolic disorders. Overfed mothers also do the same. So maternal nutrition is also undernourished. Pioneering work from Pune by Dr. Yagnik's team and others has shown that maternal undernutrition is very important for long-term NCD. That's one important point. And the last point I'll make is on the corona pandemic, not in terms of corona, that's a separate discussion, but the fact that some experts, and I totally agree with that, are calling it a syndemic. What would happen if a population has 5% prevalence of diabetes, another population has 40% prevalence of diabetes? If corona or any other future pandemic hits a population which has a low diabetes prevalence versus something that is a population that has a high prevalence of NCDs, the impact will be very different. So since we know that non-communicable diseases make us sitting ducks for the coronavirus, if we have populations that have lower prevalence of non-communicable disease like diabetes, etc., in the long run, these pandemics may again come after 20, 30 years, who knows, then we will be in much better shape because our mortality, morbidity will be much less. So there's a connect between infectious and non-infectious here. Infectious disease, epidemic disease, pandemic actually is hitting more those who are affected by non-communicable disease. So a strategy to even combat corona in the long run needs to have control of NCD in place. I'll stop there.
Thank you so much, Dr. Mittal. That these are important aspects, and I'm sure as you are endorsing that, there is a way to, kind of the restructure, enhance, and I think boost up our primary health setup as well. Dr. Nissan Jain, your experience of, so I'm, you may get some background noise of my child, crying at the background. So I'm sorry for that. This is what the, I has kind of become the part of the modern days or pandemic day discussions and work. So Dr. Nissan Jain, your thought on that, and after that I will hand it over this the further conclave and the next session to my colleague and global health advocate and co-founder of ISW Council, Dr. Bobby John, for the next session of this conclave. Dr. Nissan Jain.
Thanks, Kamal. And so, as you were asking about health and wellness center and how the preventive and primary part can be actually strengthened much faster. And I think that a lot of work has already started happening. I think more than 30,000 or odd wellness centers have already been set up. But at the same time, also we need to understand that it's not only infrastructure. It's not only putting up a building and that's it, because you need people, and at that level to have so many people who are trained, who are available, who are willing to go to those kind of areas in the field is something where a lot of reform needs to happen, which is not only medical per se, which goes beyond medical. And I think that's where the challenge will be for the government to how to actually create an atmosphere to use the health and wellness centers. So number one, to create them, which is very important. But number two, that people should start using them. Because even if you create, and for a small headache, I go to the medical college, then it defeats the whole purpose. And that's where I think the challenge is right now also, that how do I create a this whole continuum of care approach, where people first go to the nearest health and wellness center and then they get referred for things which are required. And I think that will take time. It will take a lot of effort, reform in terms of making people aware, also in terms of putting yourself in such a good quality that people are attracted to go there. You know, if there is a building of health and wellness center, it looks nice, but there is no doctor inside or there's nobody to provide care, then people will not go there. So I think that is another point which is very important, that building is there, people are there who are trained, but then the behavior of people also change so that they go there. And the last point regarding this whole continuum of care is the technology, what Dr. Mittal also mentioned. Because if you can link with telemedicine and all these kind of things, a lot of things can be provided at the doorstep itself. You don't need to travel very far. That can increase the reach, that can increase the attractiveness, and at the same time reduce the cost. So I think these things, if it happen, technology, human resources, and the trained human resources, and the whole awareness campaign, then that can help a lot in these kind of things. And as Dr. Mitra already mentioned, within Ministry of Health, of course, there has to be a focus. And I think there is a team which is working already on this. So I think that they can take care of these things. Thank you.
Thank you so much, Dr. Jain. And I'm sure with the NDHM, becoming a reality after some time, wellness and some part of it may be delivered at the home of the people, through telemedicine or your Dizzy doctor or something like this. So thank you so much, all our esteemed panelists today, Dr. Ambrish Mittal, Dr. Y.K. Gupta, Dr. Nissan Jain, Dr. Hema Diwakar for joining us. We are thankful to Honorable Minister Sri Ramdas Athavale also, who spared time in this busy schedule of today's special day. We will be joined by MOS Health and Family Welfare Sri Aswini Chaube, who is trying to figure out his time from this schedule and maybe joining us around 1 o'clock. So Dr. Bobby John will be taking care of that. So Dr. John, over to you for the next session of
Kamalji, I just want to say that Nitinji is completely acknowledged that this is going to be difficult, but being a die-hard optimist, I would like to say that, hey, everything is difficult before it becomes easy, and to win, we must begin. Thank you.
That's the spirit we all have to move forward when improving the health of our country. So thank you so much, Dr. Diwakar. And I'm sure you will share more ideas in the next panel with Dr. John also. And I will be having the privilege of hearing him after a long time, on today's conclave. So thank you so much, everyone, from bottom of my heart for today's, participation. And over to you, Dr. John.
Thank you to you too. Thank you.
Kamal, thank you so much. And thank you to the inaugural panel distinguished guests who joined us and shared with us, and all of the people who have joined us on our online platform, your thoughts about where and how we can become truly an Ayushman Bharat. The ambition is not just limited to a country. If I were to scale it up, I would say this is about 1/5 of humanity. This is about one of the largest chunks of people anywhere on the planet. And when we are healthy, when we are robust in our well-being, we will be people who will also provide the engine of growth and stability for the rest of the world. So thank you so much for all the wisdom and words that you have shared with us. And as we pivot to our panelists this session, we have, continuing from the previous session, we have Dr. Nishan Jain, we have Dr. Chandrakant Laharia, who is from the WHO, the National Professional Officer for Healthcare Access and Protection. We have Dr. Sachin Bajaj, who's the founder director of Ujala Cygnus Hospitals. Dr. Priya Balu, Senior Public Health Scientist from the Public Health Foundation of India, and Dr. Hema Diwakar, again, carrying on from the opening session, and we will continue to hear from you, ma'am. Thank you so much for each of you for making the time. And the order in which we'll kind of continue this conversation, and I would like to start with Dr. Nishan Jain and then continue on with each of you. This session, for our viewers, we are looking at the challenges of healthcare delivery, the mechanism, and also the roadmap towards wellness. And I've kind of broken up that title slightly, and you will understand in a second why I have done it, because in the way the conversation will proceed. let me just kind of put a few statistics in place for Dr. Nishant Jain to respond to. As of this morning, on the NHA website, we have 12 crores 73 lakhs and counting e-cards already there since inception, and 1 crore 45 lakhs and counting admissions. In the last 24 hours, we've had 20,000 plus admissions that have already taken place. And these admissions have taken place across 24,643 impaneled hospitals. The last bits of the opening session were beginning to veer towards how do we look at the wellness centers, how do we look at the pathway towards wellness, and not necessarily everybody landing up into the 24,643 hospitals. Dr. Jain, the infrastructure is already there, and it will continue to get scaled up, both in the public and the private sectors. What's the roadmap, and how do you see the expansion of the health and wellness care centers? Because that's where really people should be coming right at the beginning instead of going into the tertiary level hospitals. Over to you, sir.
Thanks, Bobby. Thanks, and thanks for inviting me. So, as you rightly said, that people should first go to wellness center, and that is where I think the trick lies. Because even if we give the best health insurance scheme in the world, still it will not be successful if the primary care is not strengthened enough. And it's not only a matter of setting up of these primary healthcare centers, or the health and wellness center, now we are calling them. It's also the matter of making them operational and making people use it. So I think the biggest challenge for the government will be, in my opinion, will be creating this continuum of care approach with people. Because in some countries, for example, like in Thailand, you cannot go directly to a higher level of care until it's an emergency. You have to go through a path. And many countries have followed that. And then people have that discipline that, if there is something first, they go to the nearest center where they are registered, and from there they go forward. So I think that kind of system needs to be tried here also, where people could be encouraged to go to these health and wellness center first before they go up. Because right now, people feel more comfortable going to a bigger hospital. Like even if you come to some of the biggest hospitals of the country, you will see huge OPD, and many of that for very small conditions which could have been treated very easily at the nearest place. But people still feel more comfortable coming there. And that's what I think we need to control on that. And that is something which is very important. So, but I think so one part is, yes, the government has to work on scaling up fast. So we have around, I think, 30,000 health and wellness center being set up already, but we need to reach 150,000, and we need to move fast. But I think that the other challenge, which from my angle is very important also, is the financing of the health and wellness center. Because health and wellness center right now are financed through a budget, like any government facilities finance, where you give us fixed budget and then the people can use the budget. So whether you see 2 patients or 200 patients, the budget is roughly the same. And there is no incentive or disincentive, so to say. But the countries which have done very good primary care reform, they have changed the provider payment also. So many countries, they use blended capitation, where, for example, instead of paying through a line item budget, you get money through per person who is registered with you in the catchment area. And then within that money which you receive, you have to provide the treatment. So those kind of things also becomes important. So what kind of financing reforms can also happen? I think they will need to go hand in hand, because even if you will build excellent infrastructure and teams, to make them, keep them motivated, to keep the systems much more nimble, you may need financing reforms, like government has done with PMJ, for example, where hospitals are paid based on the number of patients they treat and not based on some fixed money per year or per month. And that's where I think the money follows the patient. Similar thing, I think, not in terms of package rate, but in terms of maybe capitation or blended capitation, some kind of financing reform will be very critical if we need to make this a success. So I think that, so the roadmap for the government should be to have not only reform in terms of the infrastructure and the human resource, but it should be coupled with financing reform. And third, it should be linked with making people aware and creating systems so that people follow this path. And the backbone of all this has to be a strong IT system where you can track the patient across all level of care, whether being referred up or whether follow-up care at a downward level. Thank you.
Dr. Jain, thank you so much for that comprehensive response, because really you have broken down that roadmap towards health and wellness centers into 4 discrete buckets, which I will kind of then also request other panelists to respond to. And it's easy for me to kind of distribute this also. But really speaking, just to kind of capture it back for our audience, right now we are at about 30,000 health and wellness centers. Our ambition is to get to 150,000 of them. How we get there, how fast we get there is one thing to be delivered on, and that's a commitment. So we will see them. The sooner we see them, the better. But it will not matter if we have the 150,000, because even the 30,000 right now isn't still being utilized to the extent that we would like it to. And that requires a change in mindset. That is not a provider mindset that needs to be changed. That's already changed. It needs to be at the people who require services. How do we go about doing that? That will require a sub roadmap. How do we communicate that? And how do we ensure that there is a assurance of quality when you get to that health and wellness center that allows people to know that this is where they will get the best quality service for the problem that they have without it being escalated or deteriorated. And the more complicated part of it then is, how do we finance this, both the scale up and also the continuing utilization of it? And I'll come back to, and we have the expertise on this panel to kind of get back to answer those questions. Thank you, Dr. Jain, for laying out that roadmap. So let me kind of then pick it up almost immediately with the bit that you said, which is both a hallmark of success and also a nightmare. And this is where I turn to Dr. Shushin Bajaj. A crowded OPD or a full hospital is also telling something. It tells a story of its own, that this is a place where everybody trusts and is likely to go to. And so the doctors must be good here, the facility must be good here, so there's more and more people coming there, right? And that kind of creates a kind of a spiral, more people gathering, and so technically the hospital should be happy. Are you really happy when there are lots of people crowding your OPD for minor ailments, or would you be happier if it was slightly decongested? From a private hospital chain founder and somebody who's interested in public health and the delivery of quality care, what's your perspective?
So, thank you very much, Dr. Bobby, for this. I think the behavioral change of the community that has come in post the pandemic is quite irreversible now. People don't want to go to hospitals, especially, and even in some cases, standalone clinics also for minor ailments. Definitely not hospitals. I get many requests from patients saying that, can you ask your doctors to see us at a standalone clinic or see us at home? Our digital health teleconsults have skyrocketed. So when the pandemic hit, we were not doing even one teleconsultation because, as happens with everyone, right, when they're too lazy to do anything, they justify a lot of things. So we justified ourselves saying that, oh, we work in rural, semi-urban communities. Our community is not ready to adapt to digital or telehealth. And we never made a shot at it. But when the pandemic hit, the lockdowns came in and the electives and the OPDs went to zero, we started teleconsultations and digital health initiatives within 3 days flat. And now we are doing 35,000 teleconsults every day. So I am sure the community doesn't want to do it now. So it's not a question of whether I like it or not. I work very closely with the Delhi government on the Mohalla Clinic initiative. I was in the UK for a fellowship and I had a lot of interactions and learnings from the NHS. So if you see how the NHS model has evolved, about just 20 years ago, in the late 80s, early 90s, almost 85% of all patients of COPD and diabetes had at least one hospital admission a year, just 20 years ago, not too far. And now that number is down to 12 or 13%. They all are okay with OPD consults because how the NHS and the UK government empowered the GPs and the nurse practitioners. So when I came back, we started working very closely with the Delhi government, and we initiated the Mohalla Clinic initiative. When we started out, we thought that we would be able to take care of about 80% of all people who came in and would not need to refer them to the hospital. Very happy to tell you that that number was way off the mark. We actually started out with around 60%, then we said no 80%. I think initially would be good, and now that number is almost 96%. 96% of the people are being taken care of at the Mohalla clinic level, and they have no need to go to the hospitals, which they earlier used to do. So if you see a government hospital anywhere, you will see in the morning times 9 a.m. to 3 p.m. approximately, it's so crowded that you feel that the entire city has descended upon it. But after 3 p.m. it's like there's nothing there, because everybody has disappeared, all the OPDs are over, and they're only IPDs. So if you can actually take that load off the hospital and take it to a smaller clinic, or even better to a digital health initiative, like the health and wellness clinics, or if they go digitally, I think it'll be even one step better. I think the hospitals can work in a much better and more efficient way.
Thank you, Dr. Bajaj. I mean, the way that you've kind of described it, that it kind of suddenly decongests at 3 p.m. It's almost like people are stopped falling sick, and that the clock has struck, and it's just because the OPD has shut down. And that is essentially something that needs to be managed. What's very impressive to hear, and I'm going to kind of take words and probably put words in your mouth. Perhaps around in February, March, you had 0 teleconsults. To today, you're looking at 30 to 35,000 teleconsults per day. And you're just
per month. Sorry, no,
we
are not.
So about 1,000 per day.
Yeah.
Right. 1,000 per day is also a significant number of teleconsults. That's a huge shift that's taking place, and you're just one hospital chain that's reporting it. And I suspect that would be the same for many other hospitals. I have a question that I will now direct that to Dr. Chandrakant. Okay, because yes, we are seeing people. We would like people to come earlier on. We would like people to kind of be doing the earlier treatment seeking or care seeking closer where they are at. But a lot of this irreversible change that Dr. Bajaj is talking about is also among people who have the means to access such services. A stable internet connection or a phone that is able to kind of handle a teleconsult kind of a thing. What happens to people who may not be able to use that facility? And we have a large number of people who still will need the primary care services, but still get forced into the tertiary level centers. How do you even begin to address that?
Thank you very much, Dr. John. And it's a pleasure to see you after a long time.
Pleasure
So
mine,
we are having this discussion. We are in 9 months into COVID-19 pandemic. And pandemics are the realities of time. What matters that how we are handling the pandemic or what we learn from it. So this is exactly what is happening now. When we are talking about teleconsultations, the discussion before the pandemic was a lot to move toward teleconsultation, but there were no guidelines. So what happened with the challenge posed by pandemic, that on 25th of March or 26th of March, Government of India issued the teleconsultation guidelines. And now we essentially as a country have converted the pandemic challenge into an opportunity, which is the new way of providing healthcare services. And it has a potential in many senses. One, it is reducing the crowd at the healthcare facility, but we should also look from the patient or recipient's perspective, that people who have to go for a long queue, have to use public transport and other approaches, or different transport approaches, and then wait in the queue, now can get this at the convenience of their home. So this is a new beginning which has started. Now, as you correctly highlighted, that this benefit would reach only to some of the group people, like maybe top 20% of the population who can afford that kind of services and that facilities. But it is unlikely to reach to bottom 60%, so to say, or definitely not to bottom 20%, but not probably not to bottom 60% of population. And that's where the role of government comes, that strengthening the government healthcare facilities and ensuring the increased availability of primary healthcare facilities such as Mohalla clinics in Delhi or Basti Dawakhana will serve the similar purpose. Ultimately, the teleconsultation is a good idea. It will reduce the crowd at the healthcare facility, but may not be used for every citizen who does not have a smartphone or that kind of health phone. So the crowd which is reduced at any given healthcare facility is going to benefit those who cannot use that kind of service. But the teleconsultation or telemedicine services have opened a new door, and which should be utilized to provide access to healthcare service in the rural and remote areas. So this is broadly speaking about the question which you asked, that there is a role where people will automatically utilize some new provisions such as teleconsultation by the teleconsultation services in health sector. But definitely there is need for active intervention by the government to ensure that such provisions also benefit those who do not have such smartphones and other things. But I would also quickly want to take another 1 minute to reflect about the opportunities which are created by the pandemic, which is really a challenge. Pandemic has essentially highlighted the need or importance of smaller healthcare facilities. We know from the experience in the last 9 or 10 months that the countries which have handled the pandemic really well are the ones which has created a stronger primary healthcare network, such as Thailand, Vietnam. The countries which have created a public health infrastructure, so not only in the terms of government health infrastructure, but also public health services, preventive, promotive services. Whether those services are delivered by private sector or government sector does not matter that much. What matters, people need those public health services which should be provided. The pandemic has given us new learnings in terms of focus on strengthening primary healthcare service, irrespective of the sector which is providing, focus and attention on public health services, irrespective of service who is providing. And it still reminds us that to address inequities and to address the challenges which a poor population face, the government continue to innovate in this area. And that's where the role of the discussion in this conference, Ayushman Bharat program. We sometimes, or many people in general population think that Ayushman Bharat program is only insurance scheme, which is Pradhan Mantri Jan Arogya Yojana, while the health and wellness center related discussion, which we are discussing, are equally important. We need to keep focusing on that. I stop here.
Thank you. Thank you, Dr. Chandrakant. I mean, and you've raised two very excellent bits, and I will kind of take it in two different parts in the conversation. The first part, and thank you so much for kind of pointing out that there needs to be further intensification or further resolve to extend the service delivery points, whether it is through the Mohalla clinics or whether it's through the Basti Dawakhanas, or even actually getting those 150,000 health and wellness centers in place. But this is where, before I go to Dr. Priya and ask her about the financing part of the question that in the roadmap that Dr. Nishant had earlier put, Dr. Hema, is this a point? I mean, and this is where I'm looking at your name, artist. I mean, and you're looking at skill transfer. And each time I kind of look at it, I kind of keep thinking that you're kind of moving this from beyond just the confines of walls, whether it be a primary healthcare center or a health and wellness care center, or a kind of some kind of a facility, to actually skills in the hands of somebody who could be delivering it closer home or closer to where the point of need is. How do you see this as an opportunity? Is there an irreversibility that you're also seeing in that trajectory, in the way that Dr. Bajaj had also pointed out, that yes, there is the use for teleconsultation? Is there now a point of irreversibility for delivering services closer to home than people coming out from there, especially for maternal newborn child health services?
Thank you, Bobby. I think the first sentence that I wrote in my diary when the concept of this skill transfer came in to my mind for digital skill transfer is that we want to create history beyond the geographies, because it's really shattering the geographical walls, because it was my dream to at least train 1 million healthcare providers to take care of the 30 million deliveries which are happening every year in the country. I said the numbers are not matching. And the new courses of midwifery, for example, which will just get 300 midwives after a span of 18 months. And what do the existing providers do? Where are their skills? And when we did the baseline study, even in the private sector, the knowledge base was like 90%, but the skill actually to do things was just less than 20%. So the demonstrative modalities, the digital skill transfer, actually giving them some homeworks, they have to be ready, they have to be present on the digital platform to showcase to us, to actually demonstrate by simulations. That is the way we went ahead, and retraining, re-emphasis, reaffirming, revisions were seamlessly possible, because to paramedical healthcare providers, low dose, high intensity. Can't tell them too much and overwhelm them, but we have to also, the retention power may be, marginally less, and we cannot be complacent after just doing one program and leaving them alone. We have to make sure that they sustain and retain what they have, the skill they have learned, and by repeated role modelings and this and that and the other, we can now 100% make sure that the skills indeed have been transferred. And 2 years ago, nobody was believing, and they thought that I was just crazy dreaming of 1 million healthcare providers to be trained. But now, because the COVID has come to my rescue and everybody has jumped onto the digital platform, and now they're saying, yes, this is the way forward. So we are very happy to have strengthened our endeavor to really make sure that more and more. So the capacity building, what we want to address through the digital platform, is very much doable. And it is, we have reached Impal, Sibsagar, corners of Uttarakhand, and everything sitting out of our office in Bangalore. And that has been a solid proof of that possibility with quality. So if this quality of capacity building for different cadres in fast track courses can be initiated, and they are placed in the health and wellness centers, it will be a fantastic way forward. Even they can be trained to take the telecalls and video calls and do many things sitting with the patient sitting in their own homes and they sitting in the wellness center or in their homes. So this is very doable. Please do not underestimate the underprivileged rural women. We have many calls from them. They're very wise, and they always seek the support of their daughters and their sons to connect with us. So you can see how fast the time is flying. In another 10 years, these daughters and the sons are ones which are going to go into the reproductive age and further on to the NCD age, etc. So they are very tech savvy. So very soon you will see the whole scenario of the clientele who is tech savvy, and they can't do without a mobile in their hands, you see. So that is the culture that is coming into our country for sure. And we have to encash it and believe that if not now, very much in the near future, this is possible. And always there is a blended connect. Yes, 80% we can do by telehealth, but 20% need to come. So the crowds get diminished, the bottlenecking again, gets to the bottom line, and the 20% can efficiently be handled both in terms of the cost and quality. That's what we would like to place. And please connect and collaborate to just make this happen across the country, and in fact the whole of Asia. Bangladesh, Nepal, all are booking into the skill transfer courses and finding a huge benefit out of that. Yeah.
Thank you, Dr. Hema, and I'll come back to you very, very shortly. There are two people that have said similar things. I think almost everybody has sentiments of that thing, but I just want to capture, even though it sounds a little bit weird towards the end of a year marked by a pandemic, and COVID is something that is kind of on everybody's front and center, that COVID has come to the rescue, as Dr. Hema is saying, in influencing a certain kind of behavior. We know that COVID has distorted many of the current realities, but it also seems to be a pandemic challenge that is becoming an opportunity, as Dr. Chandrakant said a little bit earlier. Yes, we will kind of look at those as the silver linings in a very, very dark cloud, and we'll work that way forward. But as we do that, the complicated question, and this is where I want to turn to Dr. Priya, because if we have to increase the numbers of the health and wellness centers, and if the utilization remains indifferent, you still have fixed costs. Jumping off from where Dr. Nishant just pointed it out, I want to look at you for some kind of a directionality in how we go forward. He kind of used the word blended finance and many other things in blended capitations. These are all big concepts. How do you want to simplify that and help us understand how we can go forward?
Thanks, Bobby. Thanks for your question, Bobby, and I'm delighted to be part of this really interesting panel, and I'd like to thank the organizers as well. You've asked me a complex question and demanded a simple answer, and it's kind of interesting. So let me begin by saying that we have roughly about 150,000 health and wellness centers that have been allocated in the country, and it's an ongoing process. It's nothing new. It's something that the government had initiated, and we're really hoping that it will go forward. I'm going to flip back, your statement by saying that yes, 2020 has been a very dark year for all of us with relation to health, and I think COVID-19 has flipped the pyramid around in the way many countries have been dealing with the pandemic. One of the very interesting things that we see globally is that there has been over 90% of the world, countries of the world have, come up with disruptions in essential primary healthcare services as a result of COVID-19. And this is in primary care, 90% of the world's countries. So, you're talking about the big OECD countries who have established systems, whether it's the UK or Germany or Scandinavia or the United States. And then you're seeing this pandemic that is completely changing the way these countries have been prepared. And the first line to really buckle is their primary healthcare systems in many ways. So I think what COVID-19 has taught us is the importance of a grounded and a very, very strong, well-invested primary healthcare system. It's a wake-up call for all of us to pay very close attention to that. The collateral damage that has resulted as a result of neglecting primary care, where all our country health systems have been pushed towards managing COVID patients in hospitals of different denominations, has actually resulted in, your increase in NCD burden, COPD diseases being neglected. As a result of this, when the pandemic eventually dampens down with or without a vaccine, you're going to be dealing with new types of healthcare fault lines that you're invariably going to see. I completely agree with Nishant's comment that the funding of health and wellness centers has to be creative. The other thing that COVID has taught us is that countries like India, as well as Global South, can be very creative in their ability to respond to pandemic. So I see two very clear dichotomies. I see countries with strong health systems, who are traditionally powerful, faltering largely because of the expenses and the lack of primary care in many of these countries, or complex primary care mechanisms. And I also see countries in the Global South that include India, Indonesia, Bangladesh, Sri Lanka, who have been able to battle COVID using different kinds of innovation. And those innovations have come forth in the following ways. You have digital innovations that have shown very clearly that states can leapfrog health systems fault lines as long as they have the ability to think a little bit outside the box. That's the first lesson. The second lesson is really more interesting to me because COVID has also given governments the ability to take risks in areas that they would have never taken risks before. And that includes dealing with digital innovation. dealing with non-digital innovation, coming back to what Chandrakant said, that 80% of our population still may not have access to smartphones or cell phones, and therefore a lot of this innovation also has to be non-digital. And the ability for both the public and the private sector to advertently or inadvertently work together. And I think that's taught us a lot about how we want to manage health in the future. To me, I think COVID-19 offers a great silver lining. It allows us to rethink our own health system blueprint and can see very, very clearly where our fault lines lie and where we can plaster the cracks and where we can build new foundations. So I think the building of new foundations has to be in primary care. We have to rethink the way we think about primary care. So if we are having 150,000 health and wellness centers and a fantastically agile digital ecosystem that is emerging in the form of diagnostic technologies, in the form of telemedicine, in the form of human resource skill building, we have to marry the two. And we have to use something like the National Digital Health Mission to be able to create those kind of integrative networks. What we need is integrated care, but integrated care that can allow for some kind of, I think, flexibility in how we want to deliver the care, as well as flexibility in how we want to finance that care. So I think we will have to create a system by which we have to allow a creativity in financing, whether it's blended financing, whether it's contractual arrangement, whether it's bringing in private players to finance some of primary care. We have to think outside the box. And I'll leave you with just one example. At the beginning of COVID, I was in Singapore, and they are a small island, no doubt, an average population of 5 million. But SARS had taught them such a heavy lesson. It had taught them the lesson that the bulwark of every health system, no matter whether it's a Confucian-funded healthcare system like Singapore, where the individual often takes the responsibility for your own healthcare, really arises from a strong primary healthcare network. So what they ended up doing was they have a very interesting model where primary healthcare in Singapore is mixed. You have public as well as private providers. What they did was to amalgamate to create what they call primary healthcare pandemic clinics, preparedness clinics. So when the first wave of COVID emerged on the islands through different flight routes, people had a first line of response to go to through these clinics, and in turn they were moved up the healthcare value chain. This system has blended financing. In other words, people could pay for private clinics using their Medicare and Medifund, which would in turn reimburse some of the private clinics. So, I think it's a combination of creative financing as well as creative amalgamation of the different kinds of heterogeneous healthcare providers that exist in a country like India. This is an asset, not a disability. And that's how we should think about it.
Thank you, Priya. I always try to see whether I can get a simple answer, especially when it comes to systems and financing, and it's not always as easy. But here's something that I want to kind of draw out for us, and then kind of go back in a round robin again with each of our panelists. One is this question mark about what we consider as strong health systems. Is it a legacy of many, many decades, even centuries of, let's say, improved nutrition and absence of infectious diseases that allowed for a facade of strong health systems, which got ripped apart by the emergence of a novel virus, which may probably be the reason why certain other geographies have been able to respond quicker, especially when it comes to delivering care to a larger number of people. And the contrasts are in the global south. I mean, yes, we have a significantly larger problem, but we're also matching it up with a responsiveness that's been starkly different from the strong healthcare system countries. And that's something worthwhile to notice, because our resilience or our responsiveness is built on an everyday responsiveness to infectious diseases. And we have a well-oiled mechanism. Whether it is Nigeria or whether it's India, we are immunizing tens of thousands of people on an hourly basis. And so can we kind of scale up some delivery mechanism? Yes, we have a know-how, we have a chain in place. And so therefore, it may be a inflection point globally, and for us also to understand that some of the things that we have built up are actually assets, and we need to kind of leverage that. And leveraging that would also then give us significantly better benefit cost ratios. One is understanding that primary healthcare, for every rupee or dollar spent, you get phenomenal returns in disease continuum averted or morbidity averted. In fact, in some places, even mortality aversion is far greater if you just had the ability to take a blood pressure very early on, or take a blood sugar level or a urine sugar very early on, or even have a urine albumin done very early on. Those are the gateways which people would be missing out on and ending up in a tertiary care hospital with either a renal issue or a fully blown out cardiovascular event. And then it's a lot of costs, which either it goes out of pocket or an institution like Ayushman Bharat begins to step into place. So therefore, there is an opportunity. And figuring that out is going to be the opportunity that right now that we need to capitalize on. The second is how digital health and data begins to allow both at individual and at collective levels to be able to decongest and provide for an earlier access. And we can't do both without a ubiquity of diagnostics. There is only so much that you can do on digital health. We can see, but you need something more objective than that. And that is, I think, a missing piece. You can tell people, you can modify behavior, you can begin to formulate a diagnosis, but if you don't have objective evidence, we miss out on something that is critical. Somebody might say that I'm going to the toilet every 2 hours, I'm drinking a lot more water, but a simple urine sugar, in the absence of that, you don't kind of know exactly what you're hitting at. And so therefore, and this is to the WHOs, or this is to the Ayushman Bharats, this is to the health and wellness centers, this is to all of us. We need to begin to see how we have a greater push towards objective evidence also being generated at the first point of approach itself. And that all three need to be wrapped around with a skills transfer or skills enhancement that Dr. Hema has begun talking about. If we don't have that, it's pointless. We can have buildings, we can have the diagnostic kits, we can have all the infrastructure in place, but if we don't have the relevant skills to kind of make sense out of it, people are still going to be as badly off and still crowd hospitals in the tertiary care segment like before. So if we have to really make a transition, let's start the round robin again. What would be your wish list, Dr. Bajaj? What is your wish list today from a tertiary care center where you're seeing the transition, where you're seeing a silver lining? What is your wish list of the Ayushman Bharat for a roadmap which allows for you to do significant work and are not cluttered with your capacity?
So it's a question which I would love to answer honestly, if you allow me to, because
honesty is the best policy, sir.
So as an organization, see, we have always been the champions of Ayushman Bharat. We were the first ones to be impaneled. We were the first ones to do a cardiac angioplasty. We were the first ones to do a mitral valve replacement. We were the first ones to get golden certificates. In fact, out of the first 10 golden certificate hospitals, 5 were Ujala Cygnus hospitals. So we were the first ones to be impaneled in Delhi, even when the Delhi government had not taken Ayushman. So, I mean, we have been truly the champions of Ayushman Bharat just because of the fact that we feel out-of-pocket expense is something that is quite horrible. We have 60 million people slipping below the poverty line in India every year just because of healthcare costs. But as a matter of principle and policy, I do not like insurance-based healthcare at all. See, the incentives. So like you said, detecting a blood sugar level in time, right, saves so much costs. But in Ayushman, who's incentivizing me as a tertiary care hospital to detect that blood sugar? Nobody. So my incentive is completely misaligned to the patient's incentive. I will be incentivized if the patient comes to me with a heart attack, I will put in a stent and bill Ayushman or bill the TPA or bill the whatever government authority there is that, this is my cost and this is what you need to pay me. How does that help the patient except for the fact that he's not paying out of pocket? So a person who comes to me with a diabetic foot, and we are amputating 1 foot per minute right now for diabetes, right? He comes to me with diabetic foot, I amputate the foot, and I'm very happy that, I saved his 1 lakh rupees because he was having Ayushman coverage, so I did it free of cost. But is it really free? Right? He goes home, he's lost his job because he doesn't have a leg, he can't go to work. So all his future earnings that are gone now, what's that indirect cost of disease? That's lakhs and crores of rupees gone. And the scariest cost is the intangible cost. So when he's lost his job, he will pull out his children from school and send them to work. So future generations will be destroyed because I had no incentive to detect his blood sugar in time and to keep it under control, right? So I think the best use of Ayushman will be in the health and wellness centers, and particularly in the data that is being generated, because everything is paperless in Ayushman. That is a brilliant thing that has been done by the NHA, and the health stack that they've built up is beyond compare. It's amazing technology that they've used. Because right now the problem is we are very good at delivering healthcare. Indians are amongst the best, right? Dr. Hema is here, amongst the best gynecologists in the world, you can say. I mean, there would be nobody in comparison to her. But we are very poor at collating data, analyzing data, and writing good quality papers. The output of papers is negligible compared to the volume of patients we see. So right now the problem is we are treating everyone based on data that has been generated on the east coast of United States. We say that because this tablet worked well in a 6 feet 2 inch Caucasian who eats meat every day at every meal, this tablet will definitely work on you even though you are 5 feet 3 inches living on the east coast of India and eating rice all the time and have never tasted meat ever. But we'll say no, because this data is there. The data was collected and it has been used and we have no data. So Ayushman will give us wonderful quality data, and I think we have the opportunity to jump at least 20 years in the future just because of this, that now we can have predictive and preventive healthcare. We can actually go back and see that these 20 people suffering from diabetes had this particular parameter that was deranged, and all of these people with that deranged parameters 2 years ago went into renal failure. So now we need to look at them rather than everyone, right? So we can focus our energies on them, try and get their blood sugars under control. So the fact that you said use of data, preventive analytics, and the incentive to actually prevent disease, the incentive to work on healthcare rather than sick care, is something that needs to be pushed very aggressively by NHA. I have been talking to them multiple times. So even though we do tertiary care and large hospitals, but at heart, I am still a preventive care physician. I would love for people not to fall sick. That is what we want.
Dr. Bajaj, thank you for speaking from your heart, and thank you for truly bringing out costs that are not accounted for in the provisioning of, say, services like insurances, whether through Ayushman or through out-of-pocket expenditure. Because while you may avoid a catastrophic health expenditure, you still have a catastrophe on your hand if you've lost your foot, or if you had to kind of withdraw from work simply because now you've got a triple bypass and you have to kind of build up your body over a few months. So you may have a saving on one side, but that's not the entire costs. And that's where the push and the opportunity really is, to look at how we fully understand the incentives that are there both from the providers and also from those that are needing the care. How do people understand that it's not just the cost, it's also the opportunity that kind of needs to be capitalized on? And this is where I look both to Dr. Hema and to Dr. Chandrakant. I mean, both of you, one from WHO, one trying to figure out how this works at the grassroots level. What's the policy guidance, what's the practice that you would want to see happen that gets you aligned to better outcomes rather than the ones that kind of Dr. Bajaj says, it's okay. I mean, the economics works out, but the costs are far too big and not counted at all. Both of you. I mean, Dr. Chandrakant, if you can start off.
Can I?
Okay, Dr. Hema, yes, go ahead.
Yeah.
Yeah, go ahead.
So the point about the research which Bajaj brought about is really, really crucial, because the Asian community as such and the trends happening in our part of the world are pretty much different from the West. And
I'll come back to the research part of it, ma'am. I will come back because that's a point.
That is the cue I'm taking to define what works for us. So we need to document this, audit it, and see what's happening in our context to see what works. And I think moving forward, the point of care, detection of so many things, so many non-invasive, so many innovative methodologies where we can offer. So the skills that we need to transfer is not a rocket science. Even with a minimal, skilling, with these innovative equipment, point of care reaching us and we reaching them. So the right things, nipping it in the bud, the right things can be done at the right time. Speaking from my point of view in the space of women's healthcare, if every one of these 150,000 Ayushman Bharat wellness centers can keep all our pregnant women well, because pregnancy is not a disease process, they need to go there for their checkup, and 10% of them may need to be institutionalized for delivery. What is happening as of today is institutional deliveries are 90%, but the pregnancy care or the antenatal care is less than 20%. So that gap needs to be definitely bridged, because there are a lot of things, of course, pre-pregnancy also, but that is too ambitious a target. At least they're coming to us in pregnancy and we're pushing things like anemia under the carpet, not doing much for them. We are not testing for their diabetes in pregnancy. We are not even taking the blood pressure with the working apparatus. So all of these simple things of skilling, which can identify and target these women for a controlled care during pregnancy and for the entire lifetime beyond that. Because what starts for these young women in pregnancy will turn into an NCD within 2 to 5 years after delivery. So she has to be tagged. It is called a tag mechanism. This lady has to be tagged for her life, because if she is offered a preventive care, definitely 20 million diabetics who are running in the country as women with diabetes, who has originated from the pregnancy point of view, can be controlled. For this, we again need the data. Whenever we give such a analogy to the government, they said, where is your data man? And very difficult for busy practitioners to invest a lot in research, but at least the digital technology has allowed us to capture whatever little we can, see the trends, see what is happening in our own community, and where we have to plug with some very simple investments and cost-effective mechanisms to not let it snowball into something which will really cost too much and will be wasteful at the end of it for the next generation. Even the skill transfer, the way we do it digitally, is 50 times less costly than what the other skill community has been doing on site, but it's 100 times more effective. So something like this, we have to figure out our own novel jugaad way of doing things, which will be useful in the end. That's what I'd like to say. Yeah.
Thank you, Dr. Hema. I mean, and before I get Dr. Chandrakant, I want to interject. I mean, this is a very simple things, and they have got far more outsized things. I mean, and I'm going back to the time that I used to be in a village, and there used to be pregnant young women sitting outside my clinic. I mean, a simple look at the hemoglobin, a urine sugar, a blood pressure, a simple test for syphilis. Which we can do many other things. And those are not things that can happen through a digital health stack. I mean, we should not confuse a pipe that transmits or can help aggregate a lot of information with the simple tech that generates this evidence. We can see and talk to a person. but we may not get this. And this is not just for the pregnant women. These are also scalable to everybody else who turns up. And so this is where I turn now to somebody who works with a normative technical agency. What's the advice that you would give, Dr. Chandrakant, from wearing both your hats as a public health professional who speaks in the public domain, also with WHO? How are you kind of suggesting that we move further down to deepen and earlier engagement in the primary care continuum?
Of course. So talking about Ayushman Bharat program, one of the biggest success or impact of the program is that it has brought attention on health from the top level political leaders. So now from both a union level and state level, health started getting attention starting 2018, and even before pandemic brought further attention on health. So that's the biggest success. At the same time, we need to remember that while we need to celebrate the success and Ayushman Bharat program, both arms have benefited number of beneficiaries, there are still challenges ahead. For example, number of policy prescriptions made in national health policy that investment in health should go from 1.15% of GDP to 2.5% of GDP, but we don't see it increasing. Similarly, the other health will not improve and health system will not strengthen unless there is an increased investment. And we know that between 2001 and 2002 financial year to between 2015 and 16 financial year, the state governments in India did not increase their investment on health. It stayed nearly stagnant at 4.5% to 5% of state budget on health, while the target is 8%. We know health is a state subject, and that's why state need to invest to improve health. Without going to details into this, what we also know that there is a lot of attention on strengthening primary health care. National health policy said that government investment should be going largely on primary health care, and of the total government spending, 2/3 or more should be going on primary health care. But that's not happening. So we need to continually remember these things. I want to close with one aspect which you reflected in your earlier interjection, that if somebody asks question whether the well-functioning health system were ready for this pandemic, and one may wrongly infer that the well-functioning system did not succeed in controlling the pandemic. I would argue that those systems which really struggled were medicalized care system. They were not the health care systems. And so United States of America, if it is struggling because it's a medical care system, probably it's not a health care system. But if Thailand, Vietnam, or even some of the European country which has a stronger primary healthcare system, they worked really well. So I would like to close by saying that we always knew, we know that 80% of healthcare needs of the people can be taken care by the primary healthcare system. Pandemic has provided us another opportunity to bring focus on primary healthcare, and that's where we need to focus on health and wellness center component along with the PMJY if we want to succeed. And then there are other learnings which probably we need to within these components. For example, the preventive promotive healthcare, the public health services, or mental health care services which have been highlighted. I would close with the final part that there has been success in Ayushman Bharat program. For example, one of the component is strengthening laboratory services. But we realized during COVID-19 pandemic that it's not enough whatever is available, and we need to engage private sector to rapidly expand the COVID-19 services and public health laboratory surveillance. So there are many learnings which we can derive, but a well-functioning healthcare system is one which delivers healthcare services and can definitely help in taking initial burden. No health system is fully ready to handle pandemics or any challenge.
Which brings me to Dr. Priya. I mean, you have the last word on this panel. And I want to kind of preface your comments with just this observation, that from the time that the Ayushman Bharat was in inception, we had the health benefit package. It got realigned. We have now a new, call it a phase 2 or a version 2 of the health benefits package. 23 specialties, 872 packages, 1,574 procedures. There's been talk about rationalization of packages, but doesn't quite seem to lead to that link that essentially minimizes the usage of these passages and is actually beneficial. all the things that we talked about, how do we kind of get that shift towards earlier, primary, closer to home care? I mean, what is it that you would want to see happen? And what's the kind of directionality that you would be pointing to?
I'd love to see a focus on integrated care. I think while the Ayushman Bharat has done a fantastic job in conceptualizing, response to tertiary care response across both high secondary and high tertiary care, the health and wellness centers haven't really been catalyzed to their full potential. What I'd love to see in the future is that vital link that links primary care to secondary and tertiary care, forming that crucial bridge. The second lesson I think that COVID-19 has taught us is that the states that have really responded well to COVID are states that have been able to coordinate all aspects of response in a cohesive manner. They have, whether it is a municipal corporation or the state government, or going beyond even the remit of the Ministry of Health. I think what we also have to understand is that the health system is not a vertical silo that exists by itself. It involves all these determinants of health which are multiple ministries. So states that have, whether it's Kerala or Tamil Nadu or other states that have actually pushed forward in their early and very good responses to COVID are states that actually took into account all these determinants of health in their response to COVID. So coordinated care is really, really important to make a health system function cohesively. The third lesson I think I would like to see is design. And, India's health system had a design, whether it was the early Boer report, there was a design. We also had the legacy of a primary healthcare system. The bulwark of the Boer report itself was primary healthcare, and subsequent national health policies have also, stressed that. But here we have the opportunity, given these 150,000 health and wellness centers that have been proposed, to rethink how we want to design primary care. Where does it lie in the blueprint of our own integrated care pathway? How can we integrate health and wellness centers to tertiary care? How can we integrate digital health into health and wellness centers where there is a paucity for health workforce? I mean, you stressed that, we are slipping away from the basics of health, a simple diagnostic test or a urine analysis. A lot of this is also simplified diagnostic innovations that have come into the market, the health market today. So for a mixed health system like India, it's very important to look at healthcare design in a very careful manner. It doesn't have to be complicated design, but simple design. And this is an opportunity by which we can cohesively come together and look at how to design a health and wellness paradigm that will integrate care for a mixed health system like India.
Priya, thank you so much. I mean, the points that you're making essentially allow me to sum it up. We have a chasm right now between tertiary care and what we think is passing for primary care. We need to understand and figure out what is our doctrine of health. To borrow from what Dr. Chandrakant said, we don't want a medicalized care delivery system. We want a healthcare system. For a healthcare system, we need an overarching doctrine which takes into account all our assets, whether it is taxpayer funded or whether it's going to be out of pocket. How do we deliver the basic minimums when there is a collective challenge versus how do we deliver personally aspired outcomes? A nose job is not taxpayer priority, but a pandemic is everybody's priority and everybody's resources need to be brought in. And these things need to be pulled together earlier than later. A stitch in time does save 9. And therefore, we need to figure out how we get to that earlier stitch in the first instance possible? Can we be opportunistic in picking up the signals earlier than later? We don't need klaxons or red lights flashing. We need the tiniest signals from the individual closest to her or his place of comfort to be addressed. And in doing so, we might actually be able to flip around the way we deliver health, which is not a sum of doctors, nurses, equipment, and procedures and a bunch of money, but it is going to be a lot of things intersectoral coming together to deliver a sense of well-being and of being productive in society. I thank each one of you for joining us in this panel. Dr. Nishant, who had to leave earlier, Dr. Chandrakant, Dr. Sushan Bajaj, Dr. Priya Balu, Dr. Hema Divakar, thank you so much for sharing of your experience and of your wisdom. And as I hand over to Kamal, I want our audience to reflect on the need to communicate within among ourselves and also within our extended community, the urgency with which, or the fundamentality of seeking care earlier. Do not postpone something if your body is telling you something. Go get that checkup done, because it's better to have a blood pressure measured or something else addressed than have yourself in an intensive care unit, especially during difficult times. That is not a great bargain. Go ahead, listen to your body, pay attention, and get that earlier checkup done. Thank you so much for joining us. And Kamal, hand over the session back to you.
Thank you, Bobby. Namaste.
Sorry, I was on mute. So thank you so much, Bobby, and I would request our esteemed speakers to just wait for a minute, because in the normal physical conferences we used to give our vote of thank or our memento for your kind participation, for sparing time. That can't be done much now, but we would like to present a digital memento for your participation, for your kind insights which you shared about how we can fix this the problem of healthcare in our country, and especially the primary healthcare and the the preventive healthcare, which has come out very, very clearly in this session. So may I request my team to present the digital mementos for our esteemed speakers. So thank you so much, Dr. Chandrakant Laharia, for your time and taking the name from your book Till We Win, which you have authored with Dr. Guleria recently on this pandemic. I would like to take that meaning beyond pandemic, and till we win against all that ails our health, and till we win the all the impediments of providing quality, affordable, and easily accessible health to everyone, we will continue our effort, and we would like to have your patronage with us. So thank you so
very
much.
Thank you very much. And rather, the book has been released publicly today, and it's authored with not only Dr. Guleria, but Dr. Kang, Gagandeep Kang also. And it's a book on health systems, actually. So thank you very much for bringing that.
Thank you. Dr. Nissan Jain, he has had to leave for some other meeting. So we are thanking him also for his kind participation. Dr. Hema Divakar, our own and a very strong champion of women health. We are very, very honored and privileged to have your continuous support and to give further kind of strength to our mission of achieving health for all. Thank you so much, Dr. Hema Divakar.
Thank you, Kamalji and IHW. Thank you.
Dr. Priya Balu, thank you so much for your time, for your insights, and definitely with your a lot of good recommendation coming out, we would take that forward to all possible forums, that how we can have a health, primary health system maybe as robust as Singapore, which you mentioned. Thank you so much.
Thank you very much.
Dr. Suchin Bajaj, thank you so much. You really spoke about how we can prevent and avoid a lot of that which we normally don't count, and which create a disastrous impact on the lives, on the family of the people. So how we can look into more about taking care of health rather than taking care of the sick people only. So thank you so much for your insights as always.
Thank you very much. Thank you to everyone.
Thank you so much. Thank you all the speakers. So Bobby, back to you for this session. We are still waiting for our Honorable MOS for Health and Family Welfare. Prime Minister's event has got over of the new parliament, so we will be getting him maybe in some time. Till then, we let's have the next session. We already have our very, very esteemed speakers who have joined for the next session. Over to you, Bobby.
Thank you, Kamal. Thank you for the previous panel, and welcome to our esteemed guests on this second panel. We have with us Honorary Brigadier Dr. Arvind Lal, the founder and chair of Lal Path Labs. He does not need any more introduction. Almost anybody who has had some encounter with the healthcare system will have seen or taken benefit of the services of Lal Path Labs anywhere in this country. We have Dr. Anil Kukreja, who is also joining us from AstraZeneca. Thank you so much, Dr. Kukreja, for being part of this conversation with us. We have Mr. Sanjeev Navangul, Managing Director and CEO of Bharat Serums and Vaccines Limited. Thank you so much for your time to join with us. And we have with us Dr. Aman, who's joined us from Tata Trust. And am I missing somebody here right now? I'm not sure whether we are having Mr. Srinivas also join us.
No, I think
right, sure.
For the next
Dr. Singh, you're joining in from Tata Trust. Thank you so much. Thank you so much. Right. Okay. So it is literally lunchtime for many people, and I hope that those of you that are joining us on Facebook or via the various digital platforms, you do have the privilege of continuing with munching in front of your screens. We hope to provide additional food for thought while our esteemed panelists and guests join us. Please don't neglect your regular food or your regular tests and medicines at the cost of watching this program. Thank you all for joining us. I want continuity also between the first panel. Some of you may have joined in earlier and you heard some of the aspects that were being discussed, and I want to kind of continue on here too. We are talking in the context of Ayushman Bharat. We are talking about one of pretty much the world's largest health insurance provisioning, securing people from catastrophic financial expenditures on account of health. But we also have a flavoring to this panel, which is we want to focus on non-communicable diseases. In a year when everything has been focused around a virus, around an infection, around vaccines, around anti-infectives, antiviral agents, and things like that, I want us to kind of understand the fundamental role that non-communicable diseases have played in shaping the outcomes of this pandemic. People who have had diabetes, people who have had chronic ailments, whether it's related to their cardiovascular system or their renal system or their hepatobiliary systems, almost all of them have had worse or more stormy journeys through COVID than those that didn't have. And so therefore, we cannot have a conversation of health systems anymore. Earlier, when we talked about healthcare systems, it would be about maternal newborn child health. We would be trying to do infectious diseases. I think 2020 has been a giant shaking up and a waking up call for all of us to understand that health systems cannot be done without understanding the fundamental role that non-communicable diseases or systemic disorders play in shaping outcomes for us. And we can't get to that without knowing. I mean, people have talked in the earlier session about digital health and all of that. And I point out there, and I want to start there with my first question to Dr. Lal. People are thinking that digital health will allow for better management of people. And the point that I made earlier, and that the reason why I want to start with you is this. Computer systems do garbage in, garbage out. If you don't put anything in, you don't get anything out. If you don't put If you put good data into the system, you'll get good outcomes out of the system, provided you know what to do with it. In our entire rolling out of our system, we still seem to miss out on early diagnostics, on simple diagnostics. How do we address this? We have this notion of health and welfare, health and wellness clinics. We have primary healthcare settings. We still do not have a push towards earlier, simpler diagnostics. How do we begin to address that, Dr. Lal?
Yeah, it's a complex question, Dr. Bobby, but I think you have got to get started somewhere. So first of all, the importance of these so-called NCDs, in the present time, they cannot be understated anymore, or cannot be overstated, I should say. So I don't want to rattle off the figures, but I'll just like to take 2 or 3 figures. That 41 million deaths every year globally, 6 million in India, more than 60% of all deaths in India at one point of time, and about 45 to 50% of the DALIs, that is the disability adjusted life years, have been found to be due to NCDs. Next thing is that the problem is also economic, and it all starts from the money, as you've hit the nail on the head inadvertently, with spending of 1.2, 1.4% on health by the government. Well, it's not going to take you very far. We shall discuss that a bit later. But let me tell you that if we don't control these right now, we were already 1.5% down of the GDP in 2015, which I think we may be now touching about 2%. And I don't have to tell you where the GDP has gone now thanks to the COVID pandemic. So answering your question straight off, we need to do something. We are seeing in our own private practices that the NCD patients have started coming back. There was a stoppage of all these kind of patients because of too much of emphasis was there on the COVID-19, which was rightly so. But these people cannot be forgotten because, as I told you, the 60% of deaths are due to these. And if we have a large proportion of these kind of people, coming to us. So the straightforward answer is that yes, there is in India, which is there also in the tier 3, tier 4 and rural surroundings. 70% of India is staying in these kind of places, in the rural surroundings, etc. And what do we do about them? I'm just not talking about the NCD prevalence in urban areas. Everybody is very fond of talking that, well, he went to this doctor, that doctor, etc., etc. And I think it is possible to control them here, but even the segment which is not controlled here, or which has escaped detection, is the urban poor. So there are 2 sets of people I'm talking about: the urban poor and the people in the rural area, and obviously they are poor. And for this, something has to be done. And I would like to say that I think it was Priya in the previous session who actually emphasized the need for somehow tightening up the health and wellness centers, etc. And of course, Dr. Bajaj talked about the handling of the secondary and tertiary kind of things. But it is the primary one in which the NCDs have to be controlled. So how to go about it is a next topic. We can, I think, talk about it.
Sure.
Fact of the matter is that, well, we have to start going about it now seriously. I have a few suggestions, but I think I'll leave it to you and to bring them in. Okay.
Thank you so much, sir. I pivot to Dr. Anil Kukreja. I mean, I'm fascinated by your backdrop. You've got the 3 systems there, and I speak to you, and we acknowledge you both from your corporate background, but also as a physician. I mean, how do we begin to intervene with those 3 pictures that you have behind you? How early is too early, or is there something called too early in intervening and preventing things from getting out of hand?
Yeah. Am I audible, Bobby? Yeah, thank you so much. So at the outset, I want to, in fact, thank Integrated Health and Wellbeing Council for arranging this brainstorming session. And I thank Dr. Bobby for bringing this topics for us. And I think we are privileged to have an opportunity to have the discussion and contribute through our thought process and discussions. I'll just begin with, in fact, the three systems on my backdrop is nothing but we have an initiative, which is a patient-centric initiative called as Take Care of Me. It's a very holistic initiative because if you see the on the extreme right, if you see the pancreas and the diabetes, the most common disease, which is like almost we have more than 70 million diabetics in India. And we will be close to 115 million diabetics by 2030 is what is projected figure based on the our lifestyles and the way we are progressing. And if you look at the diabetes, it's not only taking care of the sugar. Diabetes affects all the organs, and I've shown the organs, particularly the heart and the kidney. And the recent evidence, if you see the heart failure, it's almost 44% of the diabetics will eventually land up into heart failure. So 8 to 10 million heart failure patients already exist, and this proportion is increasing significantly. We have a significant increase in the chronic kidney disease, and majority of this diabetics, heart failure and chronic kidney disease are not diagnosed at the early stages. And I'm just trying to bring, in fact, your question also. It's very important for each one of us, not only to spread this message, also I heard in the earlier panel, it's also the awareness of the population to reach earlier to the healthcare system. And at the same time, there has to be a comprehensive screening program for the population, depending on, of course, the age and depending on the comorbidities. Look at the holistic and comprehensive screening program implemented at the primary healthcare system so that we are able to pick up at stage 2, stage 1, instead of diagnosing at stage 4 and stage 5. By then, it is very, very late. So I would say, in fact, pick up early is the most important. And I will also highlight one important aspect of another non-communicable disease, which is cancer. We have close to more than 10 million cancer patients and almost more than 1 lakh every year new cancer patients getting diagnosed. Again, if you look at the diagnosis in India vis-a-vis the other countries, India diagnosis at a very late stage. So 1/3 of this cancer patients actually are preventable in nature. Remaining 1/3 are we can diagnose early and we can treat them with the curative intent. And the only 1/3 where it is unfortunately because of the biology of the disease, it could be more aggressive. So it's very important that we not only have a comprehensive screening program at a primary healthcare system, but also crucial for us to integrate the private health. So it should be a public-private partnership in diagnosing early. And there has to be a lot of efforts being taken, because more we delay, more we are increasing the burden of non-communicable diseases for the country, and also it will hit the economy and also the country as well. So it's very important for us to do a primary prevention, particularly when you know the linkages between diabetes, heart failure, chronic kidney disease, and other complications as well.
Thank you, Dr. Anil. You bring, and then you kind of invoke the rule of thirds as far as cancer is concerned. And I turn to Mr. Sanjeev Nawangul here. A third can be prevented, a third can be treated with good outcomes, and a third you really need to manage. And I think the rule of thirds or variations of that apply to almost every other non-communicable disease. In fact, the prevention part of it actually is much larger in the non-cancer settings. How do we, whether it's from the corporate sector, how do we signal to a largely government-run, largely government-determined Ayushman Bharat, the signal that we need to intervene earlier?
Thank you, Bobby. Good to see you. I think I'm seeing you after quite some time. And nice to see my friend Anil also. So I think it's a valid question, Bobby, that how do you wake up people who are already awake. So it's a tough one. But let me explain by a simple statistic, and this might hit everyone hard. And probably we don't make these data points more popular. They're gory, but we have to make them popular. Mumbai city during COVID times, population reduced by about 1.5 million because of migration. In that period, the number of deaths, non-COVID deaths, increased in absolute numbers. So therefore, as a percentage to population, there is even more increase in number of deaths. And they are non-COVID deaths. And we know today by the list of 10 major causalities for death that it is basically NCDs. So now when you look at this data with that greater detail, we realize that something is dramatically going wrong when such things happen. Pandemics happen or whatever happens, things start to go wrong dramatically in NCDs. I don't think people get it. And unless we make a lot of noise around such simple statistic, people will not wake up and realize that what are we sitting on. Also, Ayushman Bharat tried to tackle what was the problem of today in terms of hospital admissions, in terms of surgeries, and laying down the rules for those and all. That's fine. I think it's a great job done, and I think we should appreciate from nowhere to somewhere. But we have to solve the right problem too. And the right problem is these people land up in that situation only because there is somebody who has not taken care of it before. And in that, our worry to extend Ayushman Bharat further to some of these things where people should take better healthcare is not done because we try to solve the wrong problem of trying to find, oh, there will be fraud. I'm not a fraud detecting agency to solve the problem of fraud. I am the gatekeeper of health of this country. I should solve the right problem. I want to ensure that Ayushman Bharat gets extended further to ensure that interventions happen at the right time. And Dr. Lal is quite right, in his saying that if healthcare expenditure is so low, how do we compete or how do we manage some of these things? And I always make this point, Bobby, that look, probably this percentage to GDP in terms of health expenditure sometimes doesn't register much. But there is another statistic which registers very quickly on people now, and I've been talking about it wherever I can, is the fact that amongst the top 50 economies of the country, India is the only one where defense expenditure exceeds health expenditure. The normal ratio of the rest 49 countries is 5 times of defense expenditure is health expenditure. And that includes, you take countries like China, US, you take all those countries also. So not only we are wrong in percentage to GDP in healthcare expenditure, we are dramatically wrong in our priorities also at times. So these are important things that we need to talk about. The third part, and let me stop here for the timing, is I think an NCD patient has to be an empowered patient. And therefore, what Anil said about programs like what he is talking about, ultimately an empowered patient will take better care of himself or herself. And Bobby, you have been in public health practice for a long time. I know you are probably one person whom I know. I don't have to even say a single word. When what I mean by this is that in reality, we have to ensure that patients learn to take care of their own health, and we have to tell them that doctor is your second option. First thing is how you take care of yourself, and if you do that, there will be pressure on the system that people will be more vocal, people will be more empowered, and people will speak out. They need to be taken care of, and we will see governments moving in that direction. Let me stop here, Bobby.
Yeah, thanks, Mr. Amangol. The thing that I want to kind of rephrase something that he said for our audience on the various channels that you're kind of following this conversation on, and I want to kind of rephrase it. The best defense of a country is it's in its people being well.
Yes.
It's not the number of tanks or planes, it's in its people being well and being productive. Because when you're well and you're productive and you're able to pursue your dreams, you will have the resources to compete or to put everybody else in their respective spaces. And if you don't, then you have to take recourse to other things. And this is where I turn to Dr. Aman Singh from Tata Trust. Thank you for joining us. How do we ensure that this best defense is not merely understood as protecting from TB or for malaria or for typhoid, but is also kind of ensuring that we pick up people very early on. If the body mass index is slightly off, how do we tell a mother or a pregnant woman that, look, you need to address something here? How do we ensure that, as Dr. Hema in the previous session said, we follow this person and her child through early childhood so that you're catching up and you're not putting them into a trajectory where they will be looking at a potential diabetes? These are things that Tata Trusts have done very, very well. How do we scale it up and ensure that these are the lessons that Ayushman Bharat takes on?
Good afternoon, all. And thank you so much for giving me this opportunity to speak. Although I joined this conversation just 5 minutes before, because my colleague has to go out for an important meeting. Now, coming back to you, Bobby, what you said. Now, one of the important factor, what we have all criticized government in saying that we are not spending too much, which is very correct. We are not spending at all. We are spending 0.9% of our GDP, which this government wants by 2025, maybe, or 2024, it may go up to 2.5%. But you know, we also have to realize one thing, that at this point of time, I feel in healthcare delivery system, healthcare sector, actually this is a very, very exciting time in terms of government's approach in introducing this whole concept of Ayushman Bharat. Actually, Ayushman Bharat has two big legs. You know, one of the leg with what we have really put forward and said that insurance piece, which is being popularized so much, and another leg, which is actually, you know, strengthening of this whole primary healthcare delivery system, including, you know, strengthening the PHCs, the sub-centers, the CHCs, the sub-divisional hospitals, the district hospitals. Now, this itself, if it is strengthened well, and if it functions well, you know, our healthcare networks are pretty widespread and elaborate. I'm pretty sure that if it functions well, it will be able to take care of many, many, many situations. Now, one important piece which Ayushman Bharat actually introduced, which is a large-scale population level screening. Nowhere in the world that this population level screening of this scale actually goes on. We expect that nearly 550 odd million people, which falls into the category of being adult, somewhere in an age of about 30 to 65 years of age. So they will be actually screened. Our ANMs, our Ashas will actually go door to door, identify people with high risk condition. They will bring them to either sub-center or to the nearby PSC, screen them, and start identifying very, very early into the disease condition. Now, we all know that non-communicable disease is largely being a lifestyle disease, where we all, in spite of we all being a doctor, I mean, at least we don't do too much of exercise, we don't eat healthy food, but in spite of all that, our longevity is going up. So as longevity will go up by some condition or other, and that is what we have also seen in whole of the epidemiological transition that has happened in last 3 odd decades. We have seen that overall, globally, you will find the rate of non-communicable disease is bound to go up, because at the end of the day, the longevity has to stop somewhere, and something or other will actually kill us. But what is happening now is, if we start identifying people early, what Dr. Anil said, and even when you were saying that, you know, there is a rule of third. In India, we identify cancer almost at third or fourth stage, where, you know, after you diagnose a case of cancer, the longevity of that person on an average is about 1.4 years, not more than that. Similarly, if we identify all the precursors of diabetes, hypertension, etc., at the early stage, we are definitely able to ensure that how we should be able to, you know, ensure that this patient does not go into complications. So the effort what we have taken from these population level screening, now that is something which is a massive, humongous effort. The good part is that government of India is totally committed. There is a huge amount of political commitment and resource allocation for this thing. If we all come forward, and I will say that from the Tata Trust side, we partner with government of India to ensure that this kind of an initiative, which is taken at such a large scale, and this is something which is growing up. Other people can also come forward and start doing this. Being a physician, we will all appreciate that once people are identified early, it is easy to treat, and we can delay complication. And at the end of the day, the massive piece of Ayushman Bharat, where we actually require people to be treated when they have complication, when they get hospitalized, etc. Overall, the out-of-pocket expenditure for the same will also get reduced. So overall, what I will say is, from a public health point of view, that one piece of Ayushman Bharat, the comprehensive primary health care, that requires strengthening, and we will actually appeal to our corporate and other people, those who have some wisdom, to support that initiative. That will definitely go a long way in reducing the disease burden.
Thank you, Dr. Singh. And I want to kind of pick up one thing when I kind of come back to all our speakers once again into the next round of questions. Is this that, yes, we will have increased longevity. Life expectancy at birth has been increasing across the world. Just to put it in perspective, in 1950, life expectancy at birth in India was somewhere around 33, and the total fertility rate was somewhere around 6.7. Today, we are coming onto the cusp of our census in 2020. We should be comfortably slipping over, at least for women, into the 70 plus life expectancy. And hopefully for men also, we will have just slipped into the 70 mark. So yes, when we live longer, you'll have problems that are associated with older age. But that doesn't necessarily have to be that way. It is not right that we begin to see people in their early 20s with hypertensive features, or people with deranged body mass indices now showing up with urine sugar. Those set up for larger issues, best highlighted by what Ms. Navangul pointed out. At a time when the population of a city was going down, a strange experiment that happened, we actually saw larger numbers of people being morbidly sick or even losing their lives. And they were not all old people. Unlike in other places of the world, in India, we had younger people dying too. And that is something for us as a wake-up call and something that we need to take. I take on board what you've said. Yes, we have a very large push towards comprehensive care. In 2005, the government of India committed to 2.5% of the GDP for expenditure on health. In 2005, we repeated that in 2011. We repeated that in 2015. We're repeating the same thing in 2020. So the 2.5 number really needs to be taken with a grain of salt. What matters is what's being actually spent. And this is where I turn back to Dr. Lal. Yes, there is the ambition to comprehensive care. Yes, you've pointed out that we can do a lot better. Sir, with the experience that an organization like yours has in actually delivering, turning around, picking up, turning around, processing in between with highest fail-safe reliability, how do you transfer, or how do you begin the partnerships that allow for such robust care delivery at the point of care, or nearer to people's doorsteps?
Okay, Dr. Bobby, I'll tackle this question in two parts. One is the financial part by the government of India. So the government of India, as all of us have heard time and again, has now committed that they'll be spending about 2.5% of the GDP by 2025. So even if you start off right now, well, they've got to start spending some part of it. So I have calculated, 2.5, what would be our, GDP at that time. So what net, I'm giving you a figure now. So now we have to, start spending something like 1,25,000 crores every year, in addition to what we are already spending. Now that's a very, very, strong point, and we don't see that happening. And you heard a lot about the 20 lakh kind of incentive and doling out by the 20 lakh crore during the COVID, but I don't think much came to the medical part. So point number one is that you have got to grapple with this figure. 1,25,000 crores in addition to what you are spending already on healthcare. Are you willing to do this? If you're not willing to do this, well, I think we can pack up our bags and go home. Second part is what the government has already tried and has been, somewhat successful, is that government's Ayushman Bharat program has got two pillars. So one is the 1,50,000 health and wellness centers to provide comprehensive primary care. And the second one is the Pradhan Mantri Jan Arogya Yojana, which is ABPMJ, which looks after 107.4 million families, or about 50 crore people, giving them a insurance cover of 5 lakhs per year. So this is what I want to say, and that there is no dearth of evidence to support that the primary healthcare or the HWC's level, very high impact NCD prevention and management intervention, can be delivered here. There's no doubt about it. This is also an excellent economic investment because timely and effective primary care can act as a gatekeeper for more expensive and resource intensive secondary and tertiary care. To make an impact at the primary care level, the government and the private sector, well, everybody says so, they must come together, but how? Now, this was also recognized as early as 2018 by the then late Finance Minister, Mr. Arun Jaitley, who said that the government seeks contribution from private sector through CSR, philanthropic, and other NGOs, in running these 1,50,000 HWCs. This is all in print, nothing new. So here's a suggestion from my side. So after having, been in practice for the last 43 odd years, so this is what I arrived at, that we must do something, from the private side, to do something in the primary healthcare. So we formed a foundation known as ALVL. No guesses what is ALVL. AL is Arvind Lal, VL is Vandana Lal Foundation. And this looks after only primary healthcare, and we have just gotten started. And we are now, going to concentrate on, the vision is to, transform primary care for the masses in India, long statement, and interventions at primary care level through smart HWCs. HWCs you've all heard, but we want to make them smart. To control the NCDs is one of the key endeavors of our foundation. And therefore, we have been doing some homework, and we visited a few centers in Almora district in Uttarakhand. And there you would be shocked if I, share with you all these things. So the random glucose testing was also not available at these centers. While one center did not have any glucometer, the other had one glucometer with supply of 30 testing steps per year to cater to a population of 5,000, people around. On further probing, we also learned that the centers received their allocated budgets nearly at the end of the financial year, say about the 1st of March, and they're taken away by 31st March because you can't spend them. So this needs to change, and primary care provisions need to be strengthened, and supplementing funding mechanisms such as CSR investment, not my words, the late Finance Minister's words, must also be enabled in addition to the funding by the center and the state government. So what we are proposing is that there is a great opportunity of private companies in the health sector to meaningfully contribute in their area of expertise. They're very important in their area of expertise, but for enabling the same clarifications or amendments in the CSR rules are required, which prohibit companies to do CSR in their core business. For example, a diagnostic chain like ours cannot take up free essential diagnostic testing in health wellness centers as a CSR activity. If this can be changed for the health sector as an exception, and we've already discussed that we need to do something, significant amount of CSR funds can be channelized to improve healthcare by contribution from the private sector. And lastly, the digital backbone of the Ayushman Bharat and launch of National Digital Health Mission, that's going to go a long way. So, just to take my argument further, today at 3 o'clock in the afternoon, we are signing an MOU with Government of India's, HWCs, but this time from Ayush. Ayush is giving us 3 centers, and non-Ayush, that is the normal health ministry, will give us 7 centers to become their partners. So we are very serious about it, but it cannot be just a one-way traffic for what I have already explained all of you. So that's all I would like to say. Thank you.
Thank you so much, Dr. Lal, and congratulations on your new initiative, which is the ALBL Foundation. And we look forward to how you will take those 10 centers and make them smart HWCs, as you said. Because really speaking, we do need templates. And robust templates that are allowed, that people are able to then replicate and say, this is how it should be done. And then in that sense, our best wishes as you kind of begin this next phase of what's already been a very prolific journey on your side. Thank you so much.
Yeah, Bobby, I take this opportunity of inviting people like you and AstraZeneca, Bharat Serum, and Tata Trust, of course, to come forward in this kind of an endeavor, because we all can change primary healthcare together. That's all. Thank you.
And that's a call that we would kind of all, I think, have no problems in kind of responding to, because if there is a message that's coming through very clearly, is this, that nearly 75 years into our nationhood, we have to rethink our doctrine of health and put primacy into primary and early care. Because if we do miss out, for silly reasons like only 30 test strips for 5,000 population for a year, then we're not going to get anywhere. They may not be very palatable statistics. They rank in the same order. I mean, they sound a little bit more sillier than the one that Mr. Navangul had pointed out in terms of mortality, but they eventually have the same impact. And that's where I want to kind of turn to Dr. Anil Kukreja. How do we flood the nearest to care, or even at home levels, the simplest tools that will allow for people to know that there is a warning flag already in place? What will it take? And I'll turn that then to also to Mr. Navangul and to Mr. Mansingh. This toolkit, like every household pretty much has a tester. If you've got an electricity connection going on, some more or less has got an ability to kind of screw something on or just check whether the line is on. The equivalence of that for health. How do we even begin that? What is your imagination, Dr. Kukreja, on this?
Thank you so much. And I think I'll just build on to what Dr. Lal mentioned, and also what Mr. Sanjeev Navangul mentioned earlier. Most important would be empowerment of our citizens and the patients community. And in fact, just to share, in fact, one of our initiative which I was talking about, so beyond glucose, when we talk about diabetes, people only think about glucose. So we recently, in fact, partnered with RSSDI to empower, and we have a goal that we will empower close to 1 crore, 10 million citizens, and by leveraging the technology and by educating them through the state chapters of RSSDI. And we would really welcome any other stakeholders to participate in such initiatives, where the whole intent is that how do we explain them that diabetes is not only about sugar. It is linked to so many other systems, and if you are able to diagnose earlier, you are able to save the end organ damage and further complications of the diabetes. It's very, very important to diagnose hypertension earlier, diagnose diabetes earlier. So these are very simple, and these are not very costly intervention. It's just a behavior change. And I am reminded here actually of a theory which is called as nudge theory. I think we need to do that nudging of the whole population to make that behavioral shift and take health accountability into individuals' hand. And that cannot happen without the partnership with the primary healthcare practitioners, without empowering our ASHA workers, the paramedics who are within the vicinity and operating out of the community. And I think this is a huge capability building which is required, huge volunteering efforts which are required. I think even Tata Trust mentioned the same. I think we need to ensure that each and every, and I think we have an opportunity today. Although it's a very disastrous pandemic, but I think the way government is envisaging, and there is a political commitment from the government to ensure that the vaccination reaches to each and every high risk individual. And these high risk are nothing but people who are suffering from non-communicable diseases. So according to me, I feel there is a huge opportunity for us. The government is anyways collecting this high risk individuals. How can we ensure that we not only take this opportunity to vaccinate, but at the same time, important for us to do that behavioral modification so that at least the families, the communities are protected from uh, having those behavioral changes within the families, within the community, on having the right early measurement of these high risk factors. Uh, just like we have a state level burden of disease survey, which pointed out, which Dr. Lal also mentioned the figures, about 40 to 80% of the disease adjusted life years being wasted because of non-communicable diseases. I think it's important also to see how is the incidence of hypertension, impaired glucose, how is the uh, awareness level for high cholesterol. So can we, these are easily modifiable high risk factors. We can actually, in fact, do a basic screening and nudge the whole population and community to do that behavioral modification. So I would just say that it's important to use that nudge theory to have a population level intervention. Uh, just to, in fact, mention about our partnership with Indian Cancer Society. Throughout the belt of Ganga and Godavari, we are partnering with Indian Cancer Society to do a early screening of the most common cancers. And we have been able to identify through a behavioral modification and attracting the common population towards the screening center, we have been able to identify the people who have suspicious nodules and suspicious cancer and able to refer them. It's not only identification. I think very important is that we close the loop so that they are referred to the right center so that a proper diagnosis and management can happen. This will help us in building the trust also in the healthcare system. So that's what I wanted to just emphasize on that behavioral modification theory.
Thank you so much for pointing to the nudge theory. I mean, it actually won the Nobel Prize, Richard Thaler's work, which is trying to kind of help people think through all the incentives that allow for them to do the right thing and how do you kind of use it in a policy sense. The difficulty, and this is where the NCD conundrum comes up. With infectious diseases, with other things, if you're sick or if something is happening in your body, it shows up very quickly. In many conditions, especially those that are of chronic nature, and that also is for tuberculosis or for HIV, many times you don't know that you're sick till a longer time in the continuum of the disease itself. And so what we in the clinical world say index of or indices of suspicion, they need to be built up, or an awareness of your body needs to be built up and inculcated into every one of us. If you're sick, if you're vomiting, if you've got a headache, if you've got a fever, you know something is wrong. On many things, you don't know things are wrong. Can we as doctors, can we as the healthcare fraternity, can we as the public health system begin signaling to the widest numbers of people that it's not just these that are warning signs, or even in the absence of warning signs, you actually need to go and get a preventive health checkup. Why do you go and take your two-wheeler or your car or your cycle to the mechanic for oiling and checking out whether everything is fine? You do so because you don't want it to break down. Regular servicing, if it's good for mechanical devices, is equally valid and valuable, in fact, far more valuable for the human body. How do we get that nudge into people? If we nudge, and this is where I pick up on what Dr. Lal said, if corporates, if pharmaceutical companies, if people whose core business is provisioning of healthcare products, if they start nudging, does that become a conflict of interest as far as corporate citizenship is concerned? Why should it be so? And those are things that we need to grapple at multiple levels. And so therefore, Mr. Navango, how do we take nudges and how do we take the incentives how the disincentives that are right now there for people whose core products might be actually helping people earlier on. How do we kind of get that conversation or that realignment done so that the ambition of the 150,000 health and wellness centers, we've got only 30,000, we've got another 120,000, and I'm hoping that the 10 that ALVL Foundation will do will give us better templates for doing it. How do we get this going in such a way that it benefits a larger number of people?
We can talk about this until cows come home, but since so I'll divide it into very simple.
We have 9 minutes more.
Yes, so let me make it very simple and in a very few points. Yeah, I think index of suspicion has to be transferred to perception of threat, and then there is call to action. So we worry so much about index of suspicions that we don't really worry about threat perception. COVID has been, in a way, a great example where we can increase perception of threat substantially for NCDs. Like Bhopal gas tragedy, because of circumstances during this pandemic, aggregation of data is substantial. And we will clearly be able to throw out patterns by which make people aware that, look, NCDs have caused more harm in this pandemic than just COVID. And this could be a very, very important message to give to everybody. The second part of the story is that as much as we talk about primary healthcare centers, and which all of us have worked throughout our life to support, create a lot of activities, but I would also say, let us also, and I've done a lot of work there also in preventive healthcare. I think instead of detecting early, why should we get detected is also another possibility. And I'll give you a simple example that look at the marathon culture that has started to sprout in this country. It started with a few, and I've been a big supporter of the Mumbai Marathon, and I've done a lot of work for them. But what it has done is, and people have to then make effort to participate. Yeah, I had to do a half marathon. I had to practice for 3 months. So what it does is it inculcates a habit of better health. And marathons are now sprouting all over the country. Are there any more 3 to 4 activities that we can create from a national scale? The other one, I think the Prime Minister himself is talking about yoga and popularizing it. But there are 3 or 4 things that we can do, which will mean that we will ensure that there is a lot more activity, physical activity that people can engage in from an early age. And that can really delay the impact of NCDs substantially. The last thing I would mention is, or rather 2 things I would mention. One more is that fact that I don't think people get it, that when we look at cost of healthcare, cost of disease is not understood well. Today, hypertension and diabetes contribute to reducing 1% of GDP growth. 1% of GDP growth is brought down by hypertension and diabetes. And just calculate the value. You're talking of an economy which will be $3 trillion economy by 2025, what our ambition is. And the last thing I would say is that we also are short of doctors to ban primary healthcare centers and healthcare professionals. To augment capacity, we have to make it compulsory that whoever takes land from the government at a subsidized rate to build a third tertiary care hospital from private sector has to open a small medical school also along with it and make it compulsory to open it. It is a self-funding mechanism. People can charge fees and they can make their money, and therefore it is not that it is going to cost the hospital anything, but it will ensure that there is more capacity augmentation rather than the long winding process that we have to get an approval to start a medical college. It is like a process when by the time medical graduates start asking for permission, they would have retired by the time you get permission. So I think we can speed that up by putting some conditions. So let me.
And there are a couple of very interesting thoughts there, some of which are not in the scope of our discussion, but definitely worth something that ISW will pick up and further detail out. Earlier detection or even prevention, how do we prioritize that? And while this conversation has been around NCDs, some of the good, let's put it this way, evidence that's coming along for closer monitoring at home comes from the maternal newborn child health space. And Dr. Hema has kind of also pointed out very helpfully how home-based non-stress testing can be done so that you can kind of monitor out the progress of a healthy pregnancy. Can we kind of figure out what Ms. Navangal, you said, the index of suspicion translating to threat perceptions, how does that translate into now individual level actions that kind of then is mushrooming out? How do we signal all of that from a Tata Trust perspective, Dr. Singh, and how do you kind of then find, I mean, as the invitation has been given by the ALBL Foundation founder who's here with us, I'm like, sir, I'm using your new title right now. How do we kind of figure this whole change that looks to incentivizing earlier detection or earlier diagnosis and also preventive approaches?
I'll take on from where Dr. Sanjeev just stopped. One of the important factor is when it actually comes to perception of threat, then only then the call of action will happen. Important aspect is that if you really see our investment in actually educating people about their health. Now, health comes very last in our list. We hardly go and do any of the preventive screening checkups maybe in the chain of Dr. Lal's clinic itself. They offer so many of different types of checkups. But hardly do you find that us spending money proactively to get screened, because we all think that health is something which is absolutely guaranteed and nothing will happen to me. I mean, till it happens to me. Important fact is that we need to spend on health education. Now, this is something which we really don't do much. Small things that you have to stop smoking. Now, smoking itself is cause of many NCD conditions. Now, this is something which is easier said and done, although we have seen gradually the level of people who are smoking is going down, but still we have substantial number of people who smoke. Very simple thing about eating healthy food. Now, what are the healthy food? Now, in the era when we have so much of junk food all around, and we have seen that even in our rural population, which used to be so fit in terms of doing so much of physical activity, we find tremendous amount of NCDs in that population only because we don't eat well. Issues related to climbing stairs, doing small exercise, walking for at least 45 minutes. Now these are few of the things that will actually help people to remain fit. But what we have not done, or what we are doing less, is we are not propagating all these small little issues at the larger level. This government, at least the Prime Minister, has launched a program called Fit India Movement. Government is also promoting yoga, and now it's an era when we should be talking more about wellness than about sickness. So we have to move ahead. Few of the small things what people can do at home, like what has stopped us in educating our women folks to do self-breast examination. Now that is something which is absolutely zero cost. They just have to palpate their own breast, and if they find there are any lump which can be difficult, they can come and visit their doctor and get it checked. Examine your own mouth and see if there are any ulcers, etc. So those kind of small things. Now what we have started seeing in COVID, one very good thing has happened. Is like one equipment that really got sold a lot was pulse oximeter. People will like to check at least as a surrogate that how is my SpO2 concentration. In a very similar manner, small things like we can just keep a tape in our measuring tape, do a waist measurement of yours, and then you will be able to know how your BMIs are. I mean, those are small things that we can do. Keep a weighing machine. Now that is something which does not cost much, whether I am growing fatter or not. So those small stuff which can easily be done, and these are small but a very pertinent marker for someone who can be a possible or a future NCD patient. Now these are some of the things that we can easily propagate. From the trust's point of view, we spend plentiful on this whole primary healthcare delivery system. Recently, we had a MOU with the government of Madhya Pradesh, and there we are actually supporting strengthening of more than 500 health and wellness centers. So it will be actually, those will be the so-called model health and wellness center for in 23 districts of Madhya Pradesh. Similarly, from the national perspective, we have the whole team which actually works with all 29 states and the 29 states ministry and with the central ministry on non-communicable disease. And our larger focus is to ensure that how techno-managerial support we provide to government to raise awareness about NCDs and ensure that people actually take care, and they should be linked to the whole issues of care. So that is what we do.
Thank you so much, Dr. Singh, and thank you for also pointing to the models that you are kind of building up in the state of Madhya Pradesh from your work with that state government in the design of health and wellness centers. And I suspect that between efforts like yours, the LVL Foundation, the other corporate social responsibility initiatives that each of your own organizations are now putting out, that we will have a greater push towards people understanding that it's better to prevent something. If you can't prevent something, at least get to know your situation earlier on. And God forbid, if things are too late, be aware that there are safety net mechanisms in place that you can take advantage of, so that it's, while you still are not going to kind of get a complete solution from your disease perspective, at least you will not be catastrophically out of pocket thanks to initiatives like the Ayushman Bharat. It's been a privilege to have you, sirs, Dr. Lal, Dr. Kukreja, Mr. Navangol, Dr. Singh, to be sharing of your wisdom, of your generosity with time, with each of us here at the IHW Council. We look forward to working with you in figuring out how we move from indices of suspicion to actually looking at threat perceptions to doing some actions. And some of you will have models, some of you will have ideas of how to kind of shape this conversation going forward. We've heard from the previous panel about the areas that we need to focus on, and communication will be part of the next panel. For those of you that joined us in the last hour, thank you so much for listening. If there is a message for you, it is this. To the extent that is possible, do examine what you're putting inside your mouth by way of food. You are what you eat. And so therefore, if you can be a little bit more mindful about what you eat, you will be a lot more better off in terms of your health itself. You are how much you sit. Sitting is the new tobacco. And in COVID times, for many of you who are sitting on this screen, sitting for 8-10 hours instead of going to an office, you are predisposing yourself to another set of problems. Please get into regular activities. You may not need to run the half marathon like Mr. Navangol had set himself a target for, but you can at least do a few flights of stairs like Dr. Singh has said. Take every opportunity to move around, because if you don't, we will only get ourselves into a bigger issue. It's a new normal, but the diseases are the same. I think there is a new normal, same cancer kind of a backdrop there that Dr. Anil Kukreja said. It's a new normal, but the diseases are still the same, and you have a higher probability of being into difficulties if you don't modify your behavior and if you don't take appropriate action. Thank you for joining us. Thank you for this time. Kamal, over to you.
Thank you so much, Bobby. And it was really a wonderful session, and the kind of thoughts rolled out that are really, really very, very useful, how we are going to build a society or a country which is focused more on prevention than just sick care. So thank you so much, Dr. Lal, for your time, Dr. Aman, Sanjeev Navangulji, and Dr. Anil Kukreja. We would like to present digital mementos for your kind participation with the conclave. So may I request my team for the same? So thank you, Dr. Lal, again, and congratulations for your new initiative of health and wellness centers, smart health and wellness center, and I hope they are going to be the centers for integrated health and well-being, which will function in a smart manner. And we at ISW Council will be very, very keen and happy to showcase the success which you bring in, as in your the present initiative or the venture. And we wish you all the luck and our best wishes for the same. Thank you so much. Thank you so much, Sanjeev ji, for all your support, patronage, and always advocating, that we as a country need to set our priorities right and make health before anything else, be it even, the defense or any other part, because the best defense, as we have come to know, and what you have highlighted very well, is that the having the population which is strong, which is, healthy, which is productive, makes us better as a nation, a nation which can defend itself and can grow and progress to its optimum level. So thank you so much, Sanjeev ji. Dr. Anil Kukreja, thank you for your time, and we are with you in your advocacy and your push for making people aware about all that matters to their health, NCDs, and especially your, the big drive you are doing globally is that new normal, save cancer. So we are with you to, make sure that we take this information, awareness, and education to the people to be, to prevent and cure cancer on time. And thank you, Dr. Aman Kumar, for your insightful words and time. We are looking forward to work with Tata Trust and the institutions like this, all yours. Thank you so much. So now the next session, I hand over to our colleague and senior media professional, Anisa Nair Dhawan, who will be taking us through, and then with the esteemed panelist of, some of the finest communicators from the corporate as well as, the healthcare world, with whom we can discuss more that how we can nudge people for more preventive and health seeking behavior, and at the same time can also communicate better to them the schemes like Ayushman Bharat, which helps and kind of promises something very, very essential, like free health, but many times people may not be aware about it and how they can take help from schemes like Ayushman Bharat and many others which are there for their assistance. So thank you so much. Over to you, Anisha.
Thank you, Kamal. I've been listening to our experts through the day, and we've had insightful discussions on India's healthcare, public healthcare scenario, the inroads made by Ayushman Bharat, and what more can be achieved. Thank you so much, Kamal. Now, Ayushman Bharat scheme is the world's largest government healthcare program, where 53 crore beneficiaries are eligible for a cover of up to 5 lakh rupees per family per year for secondary and tertiary hospitalization. Now, 47 lakh people have already received treatment in the first year under Ayushman Bharat scheme. Now, the Ayushman Bharat or PMJ is a step towards universal health coverage by 2030, something that India has committed to under the UN's Sustainable Development Goals. While goals drive us to work towards fulfillment, we must also assess the execution at regular intervals. Now, in the first year, 47 lakh people got the treatment, when 53 crore people are eligible. Of course, not everyone is going to fall sick at the same time, but do all eligible beneficiaries even know about the benefits of the scheme? Is the lack of awareness about the scheme preventing many more to avail of the benefits? Are health authorities in states doing enough to ensure that the scheme reaches the last mile? In our next panel discussion, we'll talk about effective and strategic communications for mass awareness and deep penetration of the PMJ scheme into the hinterland. Please welcome our esteemed panelists who are joining us now for this discussion. We are happy to have with us Dr. Anupama Shetty, Mission Director of Icon Foundation. We also have with us Mr. Ravi Bhatnagar, Director External Affairs and Partnership, Asia Middle East at Reckitt Benckiser. We have Mr. Prabhat Sinha, Head Communications, Policy and Patient Advocacy at Novartis Oncology, and Mr. Gopal Agarwal, Director Market Access, Public Affairs and Patient Advocacy at Takeda. And we have Mr. E. Kumar Sharma, Senior Business Journalist, joining us for this discussion. A warm welcome to all of you for joining us on this discussion. Now, through the day, we've had so much discussion on public health care, on what is working, on what is our focus. But in this session, we are going to talk about how to make people aware of the benefits of this scheme. And why I'm saying this is because many years ago, I read in the paper that the Delhi government runs a health insurance scheme for domestic workers. I searched and I searched, and I'm still searching the websites, and I cannot find any details about this healthcare scheme. Everybody has maids, drivers working in their home, and we would like them to have good health insurance. If the state has one, we don't know about it. Ayushman Bharat has been launched at a wide scale with great fanfare, and people are coming to know about it. But it's a partnership between the center government and the state government. How many people know about this? Are enough people enrolling in this and enough people availing of the services? So let me start with you, Mr. Sharma. Now, we've seen more than 1 crore people, more than 1 crore treatments have taken place. Now, there is a good chance that a lot of beneficiaries don't even know about the details of the scheme. Now, there is a way by which you put in your mobile number or your Aadhaar number and you find out. But I would only do this should I know that there is such a scheme. So what do you think is the level of awareness about the PMJ scheme amongst all the beneficiaries who are largely below the poverty line?
Want me to respond?
Yes, Mr. Sharma.
Yeah. First of all, thank you so much, and really delighted that I'm here with such an esteemed panelists here. Very important event and an important space to look at, really. And Ayushman Bharat has been an important feature for the current government also. My point is essentially, as I saw the topic for the discussion, it's on mass penetration. Mass penetration essentially will be about the penetration to areas where the masses are. And for masses, actually, I think, as they say for any product, which as a business journalist would know, and anybody from the corporate world would know, the product speaks for itself. If we can talk in terms of the attributes and the strengths of what the product is and what difference it has made, I think that will convey a lot. That is one. And second point is, when we talk of mass penetration, what affects them most is very important. And that if we can focus more on, say, for instance, the health and wellness component of Ayushman Bharat, which is where India has traditionally been very weak, the primary healthcare centers. So if that is what the health and wellness component was supposed to address. So if we can communicate more in terms of what has happened, what has been the strength, how many have been, what is the investments that has gone into it, how many doctors are there, how many nurses are there, how many A&M workers visited, I think that will convey a lot. So I think if you can just talk on the attributes and the strengths of the product, it might help. For a start, if I can say.
All right. Mr. Sharma, we have the doyens of corporate India's communication teams with us here. As much as I understand what marketing works is when you talk about the solution and not your product. Your product can go on and on about how good it is, but unless you communicate to your audience that this is your problem and this is how my product will address your problem, it's gone from here and out from here.
Yeah, when you mentioned, just a quick point, since you mentioned that, I'm saying when we communicate what the product has done, what difference it will make, and it will entice the people to actually leverage its facility. If there is a good functioning government facility, I'm sure people would want to test it.
Right. Prabhat, what do you think? All of you have worked towards increasing awareness about products amongst, end users or would-be end users. Now, the government is going to bear 5 lakhs of, healthcare bills. Should I be hospitalized? I should be thrilled about this. Problem is, I don't even know about it. there was a study done and it showed that there were a few beneficiaries in Bihar who received the card in their mail and they did not know what it was. They never opened it. They never bothered what it was. So why is this disconnect? It is a great service that beneficiaries can avail of. They are privileged to that extent. But why isn't the message coming across?
Very right question, Anisha. Before that, I'll give just one example. Ever since Ayushman Bharat has launched, one thing that I have done as my individual responsibility is to ask everyone I meet, whom I feel could be a beneficiary of Ayushman Bharat, and check, do you know about the scheme? Be it the maid who works at my home, be it a new security guard who comes at my campus, or a taxi driver who drove me from airport. Now anyway, that luxury is not there, back home. And one thing I realized, 90% of people whom I have interacted with were not aware about this great program, right? And that is where it's such a brilliant program. Healthcare in India is in transformation, we all know. And the one program which is going to make that transformation is this PMJY program, Ayushman Bharat program. And as Mr. Sharma told, that it has two components, prevention and the treatment. But the whole issue is how we are taking this program down to the last person, right? And the two biggest piece in this is we are still, India is a country where 60% people do not have internet access, right? We are not in a country where everybody has an access. And it is not only access to digital world, but also access to information. That is one. Second is that Ayushman Bharat, the one document I was reading this morning, a beautiful document they have created, which is for State Health Authority. And the CEO of Ayushman Bharat, he has very clearly written that the success of this program depends on effective communication and on effective outreach, right? And that is where the whole story lies, that how effectively, how non-traditionally, and the biggest role that is going to be played by non-state actors. State actors will execute, but the non-state actors will take this program down on the ground. So I'll stop at this point of time and over to you, Anisha.
So, Anisha, can I add something with your permission?
Yes, please. Please go ahead.
Yeah, thanks. So I'm quite excited. I just wanted to jump. Sorry for jumping in between. Thanks, Prabhat and Mr. Kumar. I think as we say, very successful products can fail if they're not communicated very appropriately or people are not aware. Or worst of worst, products get successful, how they are being communicated. In fact, if I see Ayushman Bharat is definitely one of the best products for our patients, as you rightly, why people are not aware. The biggest gap what I foresee or I see, people really do not understand what is in for them. They are not part of this program, actually. They are the end user, but they are being roped in the last while this program is being developed or communicated. So everything is in plan, keeping them away, but for them. I think that's a big gap which is there, I think. And to bridge this, I think we really need to bring them up front, be a part of the solution making when we are doing, and bring some success others. Let patients themselves be the brand ambassadors of their own program. Yeah.
Right, Gopal, that's an important point. Many people say a consultative approach where you start talking and then you start building takes a large number of people along. But Anupama, such consultation sometimes takes a really long time, and by the time we have something to deliver, it has just taken too long. So sometimes, ideas, programs are pushed through, and then an effort is made to gather people into it to inform them about it. Now, Dr. Anupama, to you, who do you think the onus lies with about creating this awareness? Prabhat has spoken. I do my bit. I speak to whoever could be a potential beneficiary to talk to them about it because I know about it. Who does the onus lie on? Is it the government's job to say, look, I made this program for you and this is what it is? Is it somebody else who's going to do the talking? People who are already connected to the beneficiaries? How will we increase the awareness? And who does the onus lie on?
Thanks, Anisha. And first of all, I'd like to, thank you all and the Integrated Health and Wellbeing Council, for having me on the conclave today. And so, Anisha, I think, it's a brilliant question. And what I wanted to say was that I agree with what Prabhat said. And I think what Mr. Gopal also, the other panelists, told earlier. The fact is that, like you rightly said, a product has rolled out. How do you make people aware about it? Now, the fact is that, like Prabhat mentioned, there is a complete communication guideline which has been designed by the National Health Authority. This was even rolled down to the state health authorities. And this blueprint was brilliant in the sense it laid down and it also perceived what would be the challenges. There are several challenges which are inherent, which are ubiquitous in our health system, whether it's that of infrastructure, identification of beneficiaries, like even having a digital backbone. And like he rightly said, Prabhat said that, the CEO of Ayushman Bharat had said that communication is key. And so despite all that, what you're trying to say is that a lot of people are not aware about the program and what can be done right now. So the fact is that, based on our experiences in the field, what we saw is that, the people were not aware about the packages or how the packages are even being rolled out. Like, for example, simple things like they wouldn't be aware that, for example, extended stay was not covered, comorbidities were not covered. They wouldn't know that there was no cap on the family size. So a lot of nitty-gritties of the program itself, the beneficiaries, or as we say, these people were not aware. And so the effort from our end, at least at Biocon Foundation and through our programs has been, we are involved in a large clinics, which are digital smart clinics, has been on making people aware of the benefits of this program. What are the aspects of this health insurance scheme? But more importantly, Anisha, I think what has to change is the paradigm of communication here. While the paradigm so far has been on curative services, and you have seen that the uptake of curative services has been limited, but I would say, and I think I'm informed from previous panel sessions, and this is also a belief that the communication now has to be on preventive healthcare. You know that through Ayushman Bharat now we've had the rollout of the health and wellness centers. So how do we communicate to a person to improve his health-seeking behavior? And how do we build nudges into the system? How can you use technology here? I think we can discuss more, going forward. But we really believe that the role of the non-state actors, as Prabhat said, or it's like civil society institutions, NGOs, frontline healthcare workers, a better education, nimble technologies, all these things coming together, intersectoral linkages. There's so much more which can happen in this space, and it can, really improve awareness. And I think I want to differ from, Prabhat in one thing he said. He said that internet penetration, and he's right, it's limited. It's, more than 60% of the people do not have. But I think there's a recent study which was done by the Internet and Mobile Association of India, wherein they said that in the post-COVID scenario, internet penetration has actually increased, and it is highest right now in the rural areas. There are 227 million users, active internet users in rural areas compared to 205 million in urban areas. I think this is a great opportunity for us to actually send down messages, and promote preventive healthcare, a greater emphasis on preventive healthcare. Thank you.
Right. Now we heard the panelist, and Ravi, you're the next person I'm coming to. Now, we've seen recommend to do a lot of work with people on the grassroots, on all healthcare parameters. Dr. Nupama is saying, we have to, talk more about preventive health. Now, you could be seeing something on your mobile. Say you get a message about Ayushman Bharat and you feel, oh gosh, this is just so complicated. I cannot even understand what this is because there are many parameters, many things. But if I, spoke to the school teacher and he understood and he explained it to me, the message would go through. So the government is also tied up with a few foundations who are doing grassroots level work to, increase the awareness. So to your mind, Ravi, what will be the role that will be played by foundations, by NGOs who are constantly in touch with beneficiaries, to increase their awareness?
Thank you so much, Anisha, and I congratulate, IHW and Kamal especially to, put, this whole discussion in the panel together and bringing us all like Prabhat and Gopalji and others. I have a few submissions before, we move ahead, and very sharp ones. During the COVID time, the Dettol hand washing campaign has garnered 125+ billion views across the globe, and we started from India. This has helped in, never before equity scores of the brand, of the product. The NR growth is 35% and many other things which have happened. So my very simple submission is like, there's very less of the urban-rural divide now. There is Bharat and India. So India is consuming internet, Bharat is also consuming internet. What is one very simple message about Ayushman Bharat, what we can give to the citizens, as simple as, the Trishul of COVID, where we say hand washing, keeping the distance, and wearing the mask. So what is the one key message which can actually make this Ayushman Bharat as a Jan Andolan? That is very much required. So I am continuously following the trends on the Ayushman Bharat discussions online in the social media space. During the launch, there was a big peak when Prime Minister announced it. In between, when some new things are done or some scams are done, then there are peaks. But where are the influencers? Who are the influencers? Who are the faces? So if NGOs have to take this work forward, it needs to be very, very credible. There needs to be people like for, COVID, Amitabh Bachchan came forward. He lent his voice. For polio, he lent his voice. Like Akshay Kumar for sanitation. And, like that, many of the people who have the larger than life appeal, when they back the program, NGOs, last mile people, last mile, CBOs, community-based organizations, they also listen. Somewhere, I believe like social listening is a very important tool. We really need to think about it like, are the trends building or it's all plateau? So what is the equity level of Ayushman Bharat right now? Is social listening positive, neutral or negative on Ayushman Bharat? Do we have those trends? Has someone did some exercise on that? And if it has to be made as a Jan Andolan, there's a very, very big role of media which has to play, because you're the guys who reach to the last mile. Money may be the corporate money or the foundation's money or the government's money. How these schemes are being actually told to the last mile, that is very important. So it's so simple, one message, and you trigger the emotions. You work on the behavioral nudges and you make sure, things move on the ground. In the same way, like what's happening to Ayushman Bharat, that is really need to be seen like, where are we?
Right.
Yeah.
So Ravi, we take your point about social listening. But something as simple as washing your hands, do gaz ki duri, mask pehna is simple to understand. If I'm hearing it from a third party on a TV, I will understand. Ayushman Bharat, you will get this, but the nitty-gritties, who is going to tell me? I know in the bigger scheme of things, yes, this is happening, but more than just the influencers, do we need a one-on-one to get the message across? Ravi.
Very interesting question again, like the first thing is, there's a positive, negative or neutral sentiment, which I just spoke about. But before that, if I do the deep dive into the situation, how many people have actually listened about what is Ayushman Bharat scheme? It's a very interesting question to, find out, like, so people, have they heard about it? And then it also comes like NGOs and the CBOs and, the foundations talk on a one-to-one basis about the nitty-gritties, like, this is good for you, it's a people's movement. So where are the patients in designing this whole campaign? Where are the patient groups? Those who have got the benefit, how many of them are actually speaking and giving the testimonials to this whole campaign? I hardly see anything. I see more campaigns about other things, like, when did, sorry to put this word, but very interesting, when did Daljit Dosanjh came for Ayushman Bharat and spoke about how important this is for the farmers in Punjab? Or Kangana Ranawat, who may be speaking about how it is important for the media fraternity to join. So where are the key influencers?
Right. So Ravi is saying influencers are very important.
Everyone has a voice in the
Okay, so Ravi feels that influences are very important. Mr. Sharma, do you think that will really help in creating the awareness? Okay, you just know that there is a health insurance scheme, and at least if we have a face to it, and perhaps not just the Prime Minister's face, because a lot of people would associate this health insurance scheme with the Prime Minister because he announced it at the Red Fort. So influences is one. one of the ways to get through people so that there's a general awareness. How much do you think that general awareness through an influencer will help the beneficiaries? Mr. Sharma.
Yeah, very important point. I think we adore celebrities. So I think we always are glued on to any comment or even digression from the core by a celebrity, we latch on to it. So I think celebrities do matter, and if we have influencers, it definitely matters. But I would still go back to the point that it's all ultimately what impacts people. If we can communicate that, it's very important. India is a hugely fragmented country. It's very diverse. And what works in one place need not necessarily work in another place. For example, I will give you, like in Ayushman Bharat, I read somewhere that they give something like 60 lakh people get a free medicine for diabetes. Now, how many know? I don't know. But my point is, if we are talking of 60 lakh people who got free diabetes medicines, which region? If it is Jharkhand and Bihar, which has 4 to 5% of diabetes population, then it's a different communication. If it is, say, Tamil Nadu and Maharashtra or Karnataka, where that's 10 to 15% is the diabetes population, then it's a different communication. It's very diverse. So what one communicates, it becomes important to where one is communicating. And the last point which I want to say is also just the fact that what happens to people and how materially it has made a difference is important. See, for instance, in India, the biggest weakness has been primary health centers. Nobody in villages actually knows what is there. Is there a center with a doctor, 2 nurses, A&M people working post-pandemic? How many have taken stock of the immunization program through that center? If that is communicated, people know that this has made a difference and confidence comes up. So a celebrity added with a confidence in the product, I think will be hugely beneficial.
All right. So influencer campaigns will help. Gopal, once an influencer comes and creates an awareness and, it's targeted to where, like Mr. Sharma said, diabetes may not be prevalent in n number of states and it may be in the other states. Now, the government has a website, a call center, and now even a WhatsApp chat box to cater to the needs of the beneficiaries should they first come to know about this scheme. And if they want to check on how they are eligible and what are the benefits, then they can either call or drop in a WhatsApp message, etc. Now, the government has laid this infrastructure so that any queries can be answered. To what extent is the onus on the state governments rolling out the schemes as well? Because this is a scheme where the center and the state are working together as far as the funding is concerned. But a lot of the real work is being done by the state governments. So while the infrastructure is being laid by a call center, etc., how much will the states have to do? And at this point of time, is it fair to accuse them of not having done enough? Because this, a whole scheme is being rolled out. A lot of things, puzzle pieces are being put in place. Everything will not be done at one go. But how much more do you think the state governments can do here?
So Anisha, very, very pertinent question. I think it's quite burning question also many times, what we've seen in different aspects of the country. So when we talk about health, it's the health of our country. Yes, we say health is a state subject in our country, but we all are citizens of India or Bharat, whatever we say. So yes, we can say state has to do, but I'll say yes, lead has to be by the center, implementation has to be done by the state. So both has to work together. So a lot of work has to be done. You have to design, develop somebody like in a pharma corporate world, we say somebody develops or design at a back end and somebody at the front develop, execute at the ground. And it's a positive cycle, then it works out. If we start looking at each other, you are not done your part or you are not done your part, that will never be successful because it's not a one-time activity. It's going to be continuous over evolving activity in the market. So we have created website, call centers, but at the end of the day, people are not knowing about this. Truly, they are not aware about this. So coming back to your question very specifically, so I'll say both has to work together with the common objective of the patient at the center. So it's not what state is doing or what the central is doing. It's what happening for the patient by both of them together. I think that is the key. people have to come, or a machinery has to come out from central or a state. It is for the patient. I think that's the key, which will bring a big significant change. And I say, like IHW is doing this initiative, this also will bring some momentum. But more such consultations are needed. And when Mr. Kumar was saying something, we need to bring, when all these discussions are happening, it's not to talk about that what state has to do, what center has to do, again, what has to be done for the patient, and then role and responsibilities are being distributed accordingly. So that would be an ongoing phenomena. So we can't say one-time activity, state will do this or center will do this.
But we have the corporates here, so let's hear from the corporates on what are the strategies that work well when it comes to a dissemination of product information about benefits, etc. Dr. Anupama, what works best for a mass scheme? You could have a product which is for a set of people. This is a product which is for a large set of people who may not have enough knowledge. What would be successful ideas? Ravi is saying that we need social listening. Social listening, I guess, then the government as an agency will have to do, and then perhaps keep an agency to figure out what the social listening is saying, and then work out a strategy. To your mind, what are successful strategies to communicate about a product which is made for the masses? Dr. Anupama. Dr. Anupama, I'd request you to please unmute yourself. You're on mute.
Yeah, can you hear me now? Yeah.
Yes, please go ahead.
Yeah. So thanks, Anisha. And, I completely agree that, with Gopal when he said that it is not just the state alone, but it is the state along with the center which has to plan the communication. And here too, as a strategy, I don't think you can have a very siloed approach wherein you look at, okay, it's a center-led and state-implemented kind of a communication campaign. But the fact is that how agile is it, or how iterative is it? For example, if there is a certain grievance and you see that people are not understanding the nitty-gritties, as you said, of a program or of the product. For instance, I was telling you all before that a lot of the patients didn't understand that it wouldn't cover comorbidities, or there were certain out-of-pocket expenses which they may incur. For example, there are certain drugs or diagnostics which are not available at the hospitals which are empaneled. A patient may have to make an out-of-pocket payment. And then they would go back disgruntled saying that the scheme isn't working. I was told it was free healthcare, but I had to incur an OOP. Facts like these. So listen, I think the grievance redressal has to be very nimble. It has to go back. But is the scheme as such flexible enough, to take up all these kind of, the feedback mechanism when it's coming to you? Is the scheme flexible enough to take up, this kind of feedback? That has to be seen. And another, like I told you, I mean to say, as a strategy, and I think I come back to my point again, it's about making people aware of their own health and of the need to kind of visit the the health and wellness centers. So there I feel, at least at Biocon Foundation, and through our large clinics, and what we've been trying to do is, and especially in the COVID scenario, and the previous panelists have spoken about this, the burden of non-communicable diseases is just going to rise. Today, I mean to say, with COVID, a lot of the surveillance which was supposed to happen in the NCD space is not happening. Even earlier, I mean to say, there are a lot of stats which we can share where there are 70 million diabetics, 1 in 4 deaths is owing to CVD. A previous panelist, this was another doctor, spoke about how in Mumbai, despite a large-scale migrant, there was a lot of movement of the population out of Mumbai. Despite that, the non-COVID deaths rose. So the fact is that NCDs are here, and they're here to stay. And this is a part of preventive healthcare, which is one arm of Ayushman Bharat. So we have to push that dialogue forward also. And so I think it has 2 arms to it. The communication has to be on, yes, if you're ill, this is Ayushman Bharat, and these are this is how the whole product has been envisaged. But in terms of taking health into your own hands, I think, we have to push the needle from opportunistic screening to population-based screening. I hope that made sense. But thanks for
right.
Yeah,
Prabhat, I want to come to you now. Why a lot of us focus on the amount of treatment, secondary or tertiary care that people received in the first year in Ayushman Bharat is because what Dr. Anupama is saying about health-seeking behavior applies to everyone, not just those who are covered under the Ayushman Bharat. right? And as drug companies, you are now starting to talk about it. You just have to want to treat people, because after a point of time, there'll be so many sick people. If you don't take action now, that how much more drugs will you feed people? Now, why we are talking about tertiary and secondary care is because this is what it's a big thing for people under the poverty line. Not just in India, world over, people are dragged into abject poverty if they have to be hospitalized. Well, it is very important that we do talk about health-seeking behavior and tell people that please don't wait till you're really, really sick to take some action. We also have to tell them, if you are in such a state, you will, somebody's got your back. So, to your mind, what is the best effective strategy? We've heard Dr. Anupama talk about health-seeking behavior, about talking about being healthy, being an important part of Ayushman Bharat. That is a message that everybody has to get. So, should we have a message for everyone? And the subset is the Ayushman Bharat beneficiaries? Or should we have a separate strategy for the Ayushman Bharat beneficiaries, so that they know what is the benefit of the scheme?
So, very nice question, Anisha. See, one of the strength of Ayushman Bharat, and I think we all have to acknowledge, is the way they are using data and digital, right? And I have seen not many programs have incorporated the digital and the data, the power that they have, right? It's a phenomenal work that has been done to run a massive program like this. The second point is that what you're saying is that now how we are using this data, so there is an artificial intelligence and there is a human intelligence. Now, once there is a data, it also shows, for example, district-wise, you can see which are the hospitals where which is getting more benefit out of the Ayushman Bharat in terms of getting paid for treatment, right? And once you will see, for example, cancer care, you will see, there may not be a correlation. Now, how do we use that particular information to pull people? Now, coming back to your question, what you said is, whether the messaging is same for everyone or specific message for Ayushman Bharat beneficiaries. See, it will be very difficult to segregate messaging on ground. The messaging on ground for healthy behavior is going to be the same, and it has been same. What Ayushman Bharat is giving, it's a health assurance program. It is giving us an assurance to be eligible for that 500,000 rupees treatment. Now, and it is not that even if I have 500,000, 5 lakh rupees of health insurance benefit with us, but I need to get a health center where I go and get myself treated. That last mile connectivity, if that doesn't exist, a cancer care patient from Jharkhand will struggle to get a cancer care. He has to come to a nearest city to get that. So the communication is not only about the program, but also about where do I go and get the benefit. Using the data in, for example, I will quote again what Mr. Sharma has said is, do we talk enough on data what we get on health and wellness center? What kind of population is coming there? Whether these are repetitive people coming for screening. And the most important for any healthcare system to be sustainable going forward is also to have packages for screening, which has to be there, because unless the OPDs are going to be covered under Ayushman Bharat or any health insurance scheme, we will continue to get patients in this country at a very later stages with advanced treatment. As a system, it's a loss for everyone. So the whole strategy has to be a 360 strategy. And today, I think our government is an excellent communicator. Be it on social media, be it on digital platform. I think the best of agencies work for all these programs. So in terms of strategy, in terms of execution, it's as Mr. Ravi said, it's engaging right group of people who are going to get benefit out of it. Maybe it's the patients, community, non-state actors, and I think all the resources are there. We have money, we have the right attitude also at this point of time. Best of agencies working with government. Government has been open to listen to various sectors, but I think what is missing is collaboration from non-state actors. I think that is something which is extremely, extremely critical.
Right.
Can I add something here?
Yeah, I was coming to you only, Ravi. Prabhat feels that government is definitely going to hire an agency for social listing, and something will happen there. Perhaps you'll have a face for Ayushman Bharat. What more can foundations, NGOs, corporates do to improve the messaging amongst beneficiaries?
So Anisha, first I will carry forward what was told by my last panelist. There are two statements I would like to make. One is like 1 in 20 Google searches in healthcare at the Apple Store in India have 100,000 health apps. Second is government in various countries is basically focusing on the self-care. And third thing is our Ayushman, this Arogya Setu app right now has 16.62 crore people using that app only. And that app has come in last few months. When this is the power of this app, when this app was communicated so well, when the messaging was communicated so well, why can't some of the best practices from certain government owned programs can be translated and transported to the Ayushman Bharat also? There is plenty which is there, which was talked in the polio program in India about the underserved strategy and reaching to the last miles, where you have Musars, the rat eaters, the Dalits and everyone, and you made India polio free a few years back. So that strategy worked. Why can't those strategies or the good practices be borrowed from the other national health programs and be used here? And the state actors and non-state actors both have their own role to play. But the biggest one is how we communicate. The whole issue is there may be thousands of things which a doctor may prescribe. But जब वो बोलता है doctor, you have cancer, तो आपको डर लगता है कि अब मैं स्मोकिंग करना छोड़ देता हूं या मैं अपना कीमो चालू कराता हूं या डॉक्टर्स का विजिट रेगुलरली करता हूं. What is one key message we would like to give? If that one key message is derived very beautifully, very nicely, taking into account India and Bharat, we are well positioned to take the challenge heads on. And doctor ratio is poor, nurse ratio is poor, quality of healthcare has challenges. Should not we invest heavily on the self-care like UK has done through the NHS? So there are a lot of apps in UK like Healthily and many others, where before reaching doctor, you assess your situation so regularly, like I assess nowadays on the this Arogya Setu app, like I am in red, green or orange. So people use that app so frequently to see, should I now visit to the nearby health center to avail the NHS facility or not? There needs to be something which is pre-primary healthcare, which really needs to be invested significantly and maybe a part of the Ayushman Bharat overall, planning and dissemination. If I tell you 20% of the sub-centers in India are short of healthcare infrastructure, 22% of the community health centers are short of, the healthcare structure, and it's at all the levels. And Indians in rural, if I say, and in urban, 58% Indians in rural areas and 68% in urban areas, they go for the private in-care facilities. So is the equity of services improving? If the equity of service delivery is improving, so we should communicate to the patient groups. We should communicate to the people about the quality of service. We should give them some assurance. We are providing you the best of the best in class services. So unless we don't talk about these things, people will be thinking like, okay, this is one more scheme of the government. I'm very sure, like my previous panelists talked about, like, government has all the resources, people like Prasoon and many others who work with us as well as the government. I mean, they have the best of the brains right now. The thing is like, how the convergence takes place. So convergence means like, bridging the divide, using the technology. I still face a big challenge when I go to the primary health center and I ask, Asha worker, can you take the body mass index of my child? She is, and the doctors also.
They don't know about it.
Yeah, so they don't know how to do it. They don't know how to
so
do
Ravi,
it. Can we
I'm sorry to
artificial intelligence?
Yeah, so I'm sorry to counter everything you say. If we weren't in the middle of a pandemic, do you think people will be going to the Arogya Setu at all, or seeking any health app if you're not in a pandemic? For people who are marathon enthusiasts, who keep checking their BMIs, maybe yes. For regular people who are struggling to make two ends meet, perhaps health is not an issue. So, Mr. Sharma, how do we make it an issue? That your health is not an issue when it's bad, but your health is an issue every day. Because in our country, there's so many other issues. Unemployment, growth, so many things take precedence. If it hadn't been for a pandemic, perhaps health would not have been in focus. This scheme would have been just like any other government schemes. But if it has to be, health has to be center of everything. And here you have a great scheme. What kind of messaging is needed? And I mean, the government has many schemes. We've heard that having an influencer program, working with states, having a proper communication strategy is going to help. To your mind, how can we make, should we talk about the scheme and its benefits first, what the government is doing first? Should we talk about health and how important it is for everyone first, and then say, okay, here's what beneficiaries can do? How should the communication happen to make it effective? Mr. Sharma.
Very important question, like all your other important questions, actually. Anisha, very well framed. But I think it's important. I think health, thankfully, pandemic has done a lot of communication to people already about the importance of health. That has become central. I think many understand now. In fact, while we like to have the mask hanging, but at least we are not abandoning the mask. So there is some element of comfort there. But my point is, we traditionally have been a country where we have had a breakdown of the health apparatus. The whole concept of cadre in healthcare, health inspectors used to be there decades ago. All that structure is gone. So today here, so many beds are there. I see no reason why somebody who has a child who's not well will not go to that hospital. We need to just communicate that this is there in your area and this is there. And for that, we need to communicate. I don't know, for instance, today also, how many health and wellness centers are there? In a search, I do find numbers vary from 20,000 to 50,000. Why? One can always argue that 150,000 was the target by 22, which is about not very far away. So it's still okay. It's a third of what you wanted if it is 50,000. But we still have to hunt for it, isn't it? So my point is, if we can just communicate in a country where there is, breaking infrastructure in the health system, I think it will play a lot of role. And finally, a last point is, Ayushman Bharat, if I understand, is a very different model. Traditionally, what India has followed. This is an insurance model in inpatient hospital care model, which is very different from traditionally used to budgetary support model. So if this is a transition to the way we approach healthcare, I think that also needs to be communicated, and why this matters, why this is important, why it will help you in the long run. I think things like this will help.
Yeah, that's an important point, Mr. Sharma. I mean, I really don't know what, as an end user, how does it make a difference from what a budgetary support to an inpatient is, other than the fact that I don't have to pay the cash and, the cash cost will be covered. Gopal, I wanted to ask you, now Mr. Sharma is saying you had to create awareness about the availability of facilities. Now, I was checking with him that when we talk and we communicate, should we be talking about health? Because, health is now topical. And then talk about, okay, this is the facility, but put your health first. If you have a primary health center or you have a healthcare center close to you, go for screening, go for that OPD treatment. Even if you have to pay 100 rupees now, you will say 1000 rupees, save 1000 rupees later, do it. So should we be talking about putting health first? Should we be talking about benefits or facilities available and how you can find them? What should the communication be, and how will technology help us? Because the government's already talking about the National Health Mission. We heard Ravi say that even these health and wellness centers, primary care centers, are not well equipped. Infrastructure is a problem, but the digital health mission is visioned in such a fashion that some of these infrastructure issues may be overcome by teleconsultation, by better screening, by prevention rather than treatment. So to your mind, when it comes to messaging, is it health first and here is a facility, or here is the facility, take care of your health, and how much will technology help us?
So great question again, Anisha. I think that's what is the way forward. And we all know technology has really demonstrated even this COVID era. So this will continue to play a very big critical role. And I'll try to answer the second question first, and I'll come back to the first one, because that's interlinked. And even in the industry, the government, the patient, everybody has very well demonstrated how they can leverage technology in this era. The world continued despite such a massive epidemic impacting the country. If you see our country, it is lack of resources in terms of whether it is financial resources or a manpower resources. Our population is more rural populations versus urban population. The resources are quite not balanced appropriately. If you see our doctor ratios, less 1.33 versus 4 doctors required per 1,000 populations as per the statistics required. Our bad ratio is just 0.55 versus 2 to 3 beds as per WHO requirement. So technology will definitely help us in multiple ways. One, it will definitely help you with primary care. Why everybody should rush to like AIMS hospital for everything? For a very simple follow-up, a patient has to put a month's and appointment has to come through. Technology can solve the follow-ups. Primary care can be done. Patient histories can be done. Teleconsultations can be done. So I'm not for everything, but definitely technology will play a big role. And to make it happen, as you read, I personally feel primary care health has to be spoken first, not Ayushman Bharat. Ayushman Bharat is one of the vehicle to help you to achieve some of your manage some of your complications, which is not the desired result. You don't want complications to set in. And that's what I think Ravi or Mr. Sharma said. It should not be only IPD. It should be an overall health wellness of a patient. I think government is moving that direction. Definitely wellness clinic centers are being talked about. Ayushman Bharat should be one part, a big component to manage your IPD or an OPD and create more messages. I think 50 to 60% messages should be more around health and wellness, and leverage the technology to the maximum. I think industry is poised for it. Patient, as you rightly said, I think that 60% plus growth has been seen in urban area of internet technology in today's era. So let's leverage this to the fullest. For some cases, yes, we need vehicles like Ayushman Bharat for the treatment at the hospital, but let's leverage more Ayushman Bharat from health perspective.
Right. Dr. Anupama, I would like you also to weigh in on how technology can help us. I was at a pharmaceutical conference, and they said, there's so much data the drug companies deal with that, machine learning, AI really helps them. Now, when the digital health mission gets going, you will have so much data of patients visiting, companies will be able to tailor-make medicines that are required in particular regions, etc., etc., etc. We will have a lot of efficiencies coming in. How do you see technology impacting health services in our country, and to what extent will this help leverage the benefits of Ayushman Bharat?
Thanks, Harisha. And so I'd like to begin by saying that, the role of technology was in fact, it's been highlighted by Ayushman Bharat team itself. I think very early on, they had a startup challenge, wherein, a huge number of startups were called, and there was a competition, to see that which one of the innovations would suit and in fact improve access to care, or even the information gap. And 7 startups were identified and they were awarded. And glad to say that 3 of them were in fact from Bangalore. And what did these technologies look at? So these technologies looked at, for example, one of the technologies looked at how can I even convey information about the insurance product which is being rolled out here, in a simple language by taking away all the jargon. And 2 of the technologies were about, improving the diagnosis through simple point of care devices, mHealth applications, basically. So what I feel is, and of course, most of these applications came with an AI ML layer, or artificial intelligence or machine learning. So the fact was that you are now accessing reliable, accurate data. And as you rightly said, with the amount of data being generated, you're not looking at a transactional record, you're also looking at longitudinal records. So this is in fact one of the, and also portability of data. That's also so very critical in the digital health mission. Should I choose to go to another state and take, care in another hospital, how would my records flow from this state to another state? So portability of data, longitudinal data sets. And of course, if I were to visit a smaller center, having nimble technologies there, point of care devices with AI ML, and which also can be used in low resource settings. That's so very crucial. So I think technology is going to play a huge role. Everybody knows it, and even the previous panels, we've all spoken about it. It's all about having, from the, health and wellness centers, enabling them through point of care devices, to having records, a very sturdy digital backbone, which can actually transport your records seamlessly and ensure a continuum of care. I think technology is going to see that, it's going to play a really large role going forward.
Right. So now we're coming towards the end of this discussion, and I request all of you to give me your closing comments. Prabhat, let me start with you. What would be your 1, 2, 3 steps for effective communication and mass awareness and greater penetration of Ayushman Bharat scheme?
I think the first thing, Anisha, is to have a belief and the confidence on this program. That is the foremost thing. It's a wonderful program, right? The second is this program needs partnership. And I think partnership right from a community-based organization, starting from a national livelihood mission, any program on ground which touches people, have to start talking about this program. Then only this program, whether it is a prevention or treatment, is going to help. And the third is the best part of this program, it offers choice. And to make people available about this choice. So when we talk about the public healthcare infrastructure being weak, people do have an option to go to a private healthcare setup in the same periphery. And we have seen from the data that the private healthcare is extending more care under Ayushman Bharat. So it's all about choice, it's all about belief, it's all about partnership. I think these three things is going to make the transformation.
All right. So 3 takeaways from Prabhat: belief, partnership, and choice. Ravi, what do you think will be most effective from, of course, you feel influencers would be very important. Beyond the influencers, what more can be done to increase the penetration of Ayushman Bharat across our country?
Understanding like this is a problem, like people are not understanding what is Ayushman Bharat. The diagnostics is itself is a problem because people still don't realize this is a problem. They feel the program is going with a very right spirit and with full throttle. So someone has to sit, has to understand like the problem needs a relook into the communication design. And you talked about the social influencers. My third submission is the partnerships, the right partnerships. Like the India Health and Wellness Summit, like IHW has got people from various companies, various foundations. Why can't this be working as a working group on certain recommendations, and we make our submissions, and everyone has right to be heard. These are the only 3 things. Thank you.
All right. Gopal, what do you think will be most effective strategies when it comes to communication and deeper penetration of Ayushman Bharat scheme in India?
Yeah. So I think basically 3 things again. Leverage the technology to the best. I think it's an era, even the urban population has an access to technology. That's one. Second would be have more customized messages or get your messages developed involving patients or patient organizations. So it's quite appealing to them. Use whether real life brand ambassadors or some large ambassadors. I think that's the second part. Third, I will say very strongly, I think my other colleagues already mentioned partnership. Government can do much alone, that's true, but it needs more partners. They need more insights and technology and knowledge from larger foundations or organizations. Let's together work for the country. I think that's together work here is critical versus just doing alone. So government has to slightly open up in this area. I think a lot of things are happening so good and beautiful. It's a great time that a unified voice is there for our patients.
Mr. Sharma, what would you say as a big takeaway when it comes to effective communication strategies for Ayushman Bharat as key?
I'm seeing 3 as the favorite number, and everyone is opting for some 3 takeaways. I will be in sync with that number, and I would say essentially first what I mentioned about the product. If today, from what we know about where the masses are in India, if there is a functioning government facility, people will go for it. So first we need to communicate that is there. Second, how it has made a difference. If you can mention in terms of the way the impact has happened, the number of hospital, the number of people coming in, the number of medicines being made available, the occupancy rate, all that, if we can communicate the difference that it has made compared to what was earlier. And the third point which I meant is that if we talk of the investments which are made, India, again, I say it varies from state to state. Some states, in fact, have the healthcare budget more than double that of the national budget, and some states are woefully short. So we have a state center partnership here. We talk of how much is invested. That will also enthuse the partners to pitch in. So when we talk of how much government has gone ahead and invested, it will not only give confidence to people, but also enthuse the other partners to pitch in. These 3 points.
Dr. Anupama, what would you like to say would work best for the in better communication strategy for Ayushman Bharat scheme?
So thanks, Anisha. So I would be coming from the premise that we strongly believe that communication is not vertical, but it is also horizontal in today's age and time. And so having said that, and I think it would ping on an ecosystem of joint initiatives. Everybody's talked about that. Intersectoral linkages are going to be very crucial. And then about also innovation. How do you create a buzz? I think that's very crucial, for communication to be picked up. And that could mean your influencer groups, it could mean your social influencers on ground, it could mean all those things, but also having a very strong tech backbone. So three things: intersectoral linkages, tech, and also innovation. I think this would really speed up our communication. Thank you.
Right. I would like to thank all our panelists for joining us today for this insightful discussion on effective communication strategies for Ayushman Bharat scheme, making it effective, creating awareness and increasing the penetration of this scheme to the hinterland of our country. Thank you so much for joining us. Thank you, Gopal. Thank you, Ravi. Thank you, Dr. Anupama. Thank you, Mr. Sharma. Thank you, Prabhat. Thank you all for joining us.
Thank you.
Please stay with us. I would like to hand over to Kamal, who would like to say a few words to you as well.
Thank you to you as well. You've communicated so very effectively.
Thank you so much, Anisha, and all our esteemed speakers for a very insightful, wonderful discussion which we had. Definitely highlighted that how we need to mobilize, the whole public and take the message of health, be it from Ayushman Bharat or the self-care of people, reaches to the masses, and they also respond to it. They adapt to it. We began today's day by saying that what Ayushman Bharat stands for is not the Pradhan Mantri Jan Arogya Yojana or just the health and wellness center. What Ayushman Bharat for our country, for our culture, or maybe for our ancestors stood for is having a long, productive, healthy life, and for everyone. And I think that was the whole philosophy, and that's why Ayushman Bhava was used as a blessing for everyone. So we want at ISW Council, or I think that should be the vision and the aim for everyone, that how we as a people start looking for having a long, healthy and productive life, which is ultimately contributing to our national growth, to realize the aspiration of our country, our people, and everyone, and get the real place for our nation in this world. And with this, with the judicious and I think optimum leverage opportunities for everyone. So thank you so much for all you, for being here, for sharing your thoughts, how we can, move towards that vision of where people have, that kind of life, which is, which brings them that, the fullness of being into this existence, being happy, and also having all that matters for their health and for their family. So thank you so much, all our speakers. We would like to present our digital memento for your participation in this conclave. So Dr. Anupama Sethi, thank you so much for your continuous participation.
Thank you.
ISW forums. I heard you last time, I think in the Bharat Nutrition Week. So thank you for being with us again, Dr. Also Gopal Agrawal ji, thank you so much for your time, and we look forward to have many more such discussions, but also work together. The partnership and I think collaboration was the two key words coming out from this discussion also. So we at ISW Council are open to pursue the health of our nation, of our people, together with all those who are looking for achieving this goal. So thank you so much for your time and your participation. Prabhat Sinha ji, thank you so much for your participation, and we also thank Novartis for your continuous support, and we had a wonderful and I think a very, very impactful initiative in form of Breast Cancer Awareness Month in the month of October, where we tried to at least, bring in a new energy and advocacy among the people to take awareness to action when it comes to preventing or, curing breast cancer on time. So thank you so much for your participation.
Thank you, Kamal.
Raviji, thank you so much for your support, your participation, and wonderful thoughts as always, and your wonderful work which you are doing under Dettol Swachh Banega Bharat and Swasth Banega Bharat also. You are really mobilizing and kind of encouraging people towards healthy practices. So keep doing that work, and thank you for participating and attending this session. Mr. E. Kumar Sharma, thank you so much. I'm sure you are, encouraging and helping and educating people through your pen as a journalist, and also by participating in this kind of discussions, you are bringing a lot of insights. So thank you so much for participation.
Thank you for having me there. Thank you very much.
So with this, we are, concluding our second edition of Ayushman Bharat Conclave. With a vision, with a hope that the journey which we have to all move forward and take of making India healthy, Ayushman, with whatever possible tools or mediums or missions like IPMJ, Health and Wellness Center, Fit India, Swasth Bharat, Atmanirbhar Bharat, whatever it is take, let's make Bharat Ayushman, that where everyone has a healthy, happy and productive life, and that will help achieve all other missions, all other aims we look for as a nation, as a society and as people. Thank you so much.
Thank you.